No medicine can remove the cause of a lifestyle disease, but you can.
What we are doing is actually putting a stent, doing some plumbing work, or doing a bypass surgery, and again increasing the inflammation. And we are thinking that we are giving a false confidence that you are getting treated. If you are taking alcohol, even the usually most of the attacks comes especially in night, and there is a possibility that if you have taken a few pecks and then going for sleep, there is a risk of cardiac arrest or the heart attack and all. Everyone should understand that if you do a bypass surgery, that doesn't mean your life expectancy is increased. When they are using steroids, automatically the blood sugar will go high. So the diabetes medication has to be started. So we had to come to the root cause. See, only in the cardiology point of this putting the stent and doing the bypass is only superficial. There are some patients who are coming not because of much of understanding. Actually, he wanted to try this clinically supported lifestyle correction before his heart surgery.
Welcome to this before and after series on health, where we look at different treatments for various lifestyle diseases. This time we are handling heart disease, and it is been divided into 5 different sections. The first section is on what are the causes and what are the ways of early diagnosis of heart disease. The second is on the latest available treatments at present. The third is on the comorbidities that usually come along with heart disease and which any heart disease patient should be aware of. And the fourth is the importance of lifestyle correction in treating heart disease. The fifth and final one is on examples of various patients who have undergone lifestyle correction under clinically supported conditions and what are the experiences that the doctor has in these cases. Welcome, Dr. Jolie. Dr. Jolie Thomson has extensive experience in treating lifestyle diseases, and her focus is on minimizing the need for surgery and medicine. The first question to Dr. Jolie is, apart from the causes, for a patient or for a general well-wisher, what are the various ways in which they can understand that there is something wrong with their heart?
Nowadays, it is very common that very young people are just falling down and dying. And many of the things, it may not be heart attack alone or heart attack, stroke, and many things can bring sudden death. But especially after the COVID, the sudden death because due to coronary artery disease, the cardiac arrest and cardiac problem is actually increasing. So many will be thinking that when they're talking, there was no problem, no health issue, but suddenly collapsed and died, or suddenly collapsed and taken to the hospital. Angiography or angioplasty is done and needed a bypass. Even bypass surgery is very common, even in 30s and 40s also nowadays. So it is very important from the cardiac point of view. The most important thing is to diagnose it early, not when you are falling down. You have to. The golden time is before getting a heart attack. So the early diagnosis, there are so many methods in the diagnostic sector. There are so many methods are there, so many tests are there to find out the heart health. And most importantly, we should understand that the heart health is not standing alone. Heart test is a manifestation of the whole system or the whole body. If you have diabetes or hypertension, that itself shows that your cardiac health, heart health will be damaged. So that is, we have to give importance for the early diagnosis as such.
Actually, when you mentioned about the issue of having diabetes or hypertension, that creates the ground for heart problems. Similarly, we hear that obesity, even autoimmune diseases like arthritis, and all those sort of diseases that are now quite common, they also contribute to heart disease. So, can you explain to the viewers what exactly is it that patients who are having these diseases, what is it that they should know regarding their heart?
Basically, when you usually all the talks about the heart disease and how to prevent it or the predisposing factors, we all talk about the smoking and the alcohol. That is all is very important. So I'm not talking about that aspect because everyone knows that if you are a smoker, the heart risk is increased, and also If you are taking alcohol, usually most of the attacks comes especially in night, and there is a possibility that if you have taken a few pecks and then going for sleep, there is a risk of cardiac arrest or the heart attack and all. So the other things which we are usually not talking is, the first thing is obesity and the metabolic syndrome. Obesity, the metabolic syndrome means your metabolism, your chemical activity of your body is in an irregular manner. So that will definitely, heart also part of the, actually heart is giving all the nutrients, and it is pumping, and the blood is flowing because of the heart's working as a pump. So if there is a metabolic problem, the chemical reaction, there is a change, it will be most importantly reflected on the blood vessels. The blood vessels get damaged. So when we consider the predisposing factors, diseases, diabetes, hypertension, cholesterol or dyslipidemia, even arthritis, everywhere there is a metabolic error is happening. So if the pressure is increasing, hypertension, that means the heart workload of the heart is increasing, and the blood vessels capacity to dilate is under compromise because of this calcium buildup, or this blood vessel walls become rigid actually. So if the pressure is increasing, either the blood vessels is getting rigid and the dilating capacity is reduced, that we generally call it atherosclerosis. And one type of atherosclerosis is called atherosclerosis, that is the plaque formation, and for that we are putting the stent and the bypass, etc. is done for that block to relieve that. So, but usually we are only treating actually, but we are not trying to prevent the disease for a more conscious way. We are not trying to prevent. So, if you have diabetes and hypertension or dyslipidemia or excess cholesterol or triglyceride, you should understand that you are prone for a heart disease, and we have to correct that, not to take medication for that. It's all lifestyle disease. Actually, these sort of lifestyle diseases are becoming the real causative factor for. The same is applicable for the arthritis and autoimmune disease, etc. The rheumatoid arthritis, it is actually affecting, we are feeling the pain on the joints, but it is affecting the blood vessels also, because joint is the same material, that is collagen, is used for the building of the blood vessels also. Collagen and elastin, actually that they are actually making the blood vessel flexible and dilatable and all. So if the collagen and the elastin, that is the protein which is mainly used for this blood vessel wall, it is getting damaged. Just like the collagen on the joint, it is getting damaged, but those places you feel the pain. The pain is pain receptors are very much present in the joint, so you feel the pain. But there is no pain receptors in the blood vessels, so you don't feel the pain. So that is the only difference. If you are having somewhere pain, that means the inflammation is generally, it is affecting the blood vessels also. If you get a cut on the blood vessels, so you may not feel the pain. Only you will feel the pain on the skin or the joints. But the blood vessel as such doesn't have any much of this pain sensation, so we ignore it. So we understand that if there is arthritis, there is the blood vessels also getting damaged.
Actually, when we are talking about diagnosis for a normal person, he would always prefer some blood tests or an ECG and all that, rather than an invasive test like angiogram and all that. So, what exactly is possible, to know about the heart condition from these blood tests and this ECG?
Early diagnosis point of view, to prevent the heart disease, it is blood work and your body composition. Nowadays, there's facility to assess what is the composition of your body, how much muscle it is. Most importantly, the muscle mass and lean mass ratio. See, ideally, gents should have around 10 to 15% of fat mass, and the rest should be only 15%, 10 to 15% should be fat. And for the ladies, it can be slightly higher, 15 to 25%. So, if you are able to keep that, whether that you are able to keeping it up like that, that is the most important. When they say in Indians, especially there, we are more of the if the same BMI, and when we are compared to the model, if you are taking Caucasians and the Indian or the South Asians, generally we have more fat in our body, and inside the fat itself, the brown fat, there are two types of fat. one brown fat which is thermogenic, or it can be easily converted into energy or in the form of heat. That will be higher in the Caucasian group, and in Indians and the other South Asians and Africans it will be low. So the other type of fat will be predominant. So almost 30% difference can be there. So that is the reason why we get this, Asians get, especially when working in the part of India, basically in the South India. So we get almost 10 or 15 years earlier when you are comparing the heart attack age and things like the age comparison and all. We get the heart attack at an early age, even 10 or 15 years early. That is happening actually in other diseases also, like cancer, breast cancer. Those things also is getting in the early stage. That is because of the mainly one of the reason is fat distribution. Actually, many people, we are in the medical field also not talking much here. Is one aspect is the control of the immune system. We call all these diseases as a inflammatory disease. The immune system has two wings, inflammation and anti-inflammation, that is preventing the inflammation. This is actually controlled by the two fat. One is omega-3 and one is omega-6. Everyone knows that omega-3, the fish oil and all, is good for heart. But we don't know, no much of talk is there about the omega-6. So omega-3 is reducing or the omega-6 is increasing is equally bad for the inflammation point or immunity point of view. Omega-3 is anti-inflammatory and healing part, and omega-6 is inflammatory. That is also, it's needed and it is good, and it is actually from your as a defense point of view to prevent infection and all, it is good. But inflammation, over-inflammation, too much of inflammation is the reason for almost all the lifestyle diseases. And even in the infection also, we know that COVID time, the inflammation, too much inflammation is the problem, and we are trying to block that inflammatory process with this steroids and all. So all the medications actually we are using in the modern medicine is somewhere in this pathway, that is the inflammation and anti-inflammation, that is omega-3 and omega-6 pathway. It is actually blocking the inflammatory pathway, actually. That is actually giving you symptomatic relief. That is applicable for the heart disease also. We all know that the coronary artery disease, we check for the calcium score, test as a scan is there. And in that actually inflammation, that is over-inflammation, and with the calcification, that is actually making the coronary arteries very rigid. And that is why that if the calcium score is very high, you won't be able to put the stent. Then such patients, they have to go for the cardiology. Interventional cardiology will not have much role. Then the bypass surgery has to be done. So all this cardiac problem also is connected to the inflammation that everyone should know.
Actually, you just mentioned that South Asians have a different body composition, which creates conditions for earlier onset of heart disease. It is also heard that that South Asians generally age around 10 years earlier than Westerners with respect to metabolic diseases. What is it that we in South India, for instance in Kerala, what is it that makes us in Kerala age metabolically faster than Westerners? Though we normally notice that the skin texture of Westerners gets aged faster than South Indians generally. So what is it that is causing this problem in South India and or in India itself?
Basically, Indians have a very good advantage because our skin has much more resistant to sun. It is skin wrinkling and all is because of the sun's effect, that is ultraviolet rays effect and all is there. So we have a better skin health because we have a moderate amount of melanin, so that will prevent. And if too much of darkness, like in African countries, that also prevent that will prevent that ultraviolet rays, but it will prevent the penetration of the good part of the sunrise also. So we have a moderate coloring, and so it will be good for the point of view of the skin coloring. But our problem is maybe because of the earlier life, this genetic and development in our genetics and all, we have always have the tendency of excess fat accumulation. That itself is not the brown fat, it is the storage fat. The white fat will be, or yellow fat will be more in our body. And that is actually, if what you're, that fat, whether it will lead you to disease, is depend on what is the composition of the fat. That is, if the omega-6 is, that is inflammatory, if it is high, if you are eating this vegetables, to me that your fat and your excess fat in the body, excess tummy, is because of you are eating too much of nuts and oil seeds, or too much of vegetable oil. Generally, almost all the vegetable oil except the coconut oil and palm oil. Palm oil is also only 10%, comparatively very low in omega-6. Coconut oil doesn't have much of the omega-3 or omega-6. It's only saturated fat. So it is inert. But if you're eating this cashew nut, badam, pista, all sort of these nuts and the oil seeds, like any oil seeds actually, others like peanuts, it all having high amount of the omega-6 fat. So if the omega-6 is accumulated in your body, the inflammation will flare up. That is the basic thing. But we can find out this, what is the inflammatory level of the body. So in the heart patients, due of the inflammation of the blood vessels, we can assess. Nowadays there are so many tests are available. The cardiac markers and inflammatory markers, these all come higher in very early stage itself. Even the blood sugar, even the diabetes, understand, you should understand that this is the type 2 diabetes which is creating problem. There is insulin resistance. Insulin quantity is high. Actually, this hyperinsulinemia is promoting the deposition of the fat inside the blood vessels and blocking it. So, but unfortunately, what we are treating actually for the diabetes itself, we are actually, this type 2 diabetes also, we are in the injection, giving, even putting insulin pumps on if you are affordable. So it is scientifically it is wrong. It is actually, if you, even for the type 2 diabetes patients, if you are taking medicines to increase the insulin secretion or injecting insulin, is actually damaging you. You are only looking into the diabetes and the glucose count. Glucose may reduce, but the insulin level is increasing. I have seen patients who are having, even last day itself, the patient is not diabetic, and he's having all sort of problems. Is there very tired, and he's having obesity is there, tiredness is there, fatty liver is there. His HbA1c also only 5.4, but his insulin level is 300 and something. So hyperinsulin, any hormone, just deficiency of the hormone definitely is a matter. In type 1 diabetes, there is a deficiency of the insulin and you have to take insulin injection. But in type 2 diabetes, there is no deficiency, and many of the people, the hyperinsulinemia is there. In that case, we had to correct this metabolic error. Instead of giving injection to raise and give insulin and making the, when you are taking, increasing the insulin level, you are encouraging the body to, in the opposite way, to deposit it inside your body. If you are not taking, if it is excess in sugar, you are not, you are taking carbohydrate, and if you are not taking insulin or the anti-diabetic medicine, it will be excreted in the urine. Instead of that, you eat all the carbohydrate and take insulin, and it is allowing it to get deposited in your body. Whether when your adipose tissue is full of fat, it will be diverted into the, it doesn't have any place to deposit. So it will be circulating in the blood, and that is shown as the increased triglyceride. Actually, the triglyceride, that is the fat part of the in the blood, that is increasing, and there is no place to deposit, and then will be to get deposited in the blood vessel itself.
From what you said, it is like, the insulinemia, hyperinsulinemia, that is high insulin, which is quite common in diabetes patients who are under treatment with insulin injections or with medications to increase insulin output by their pancreas. They are actually under more risk of cardiovascular disease, and that insulin itself, high insulin itself, is one of the major causes of it. So next, we would like to know that regarding tests, the other interventional tests and all, like angiogram and the others associated with angiogram, regarding those tests, that is angiogram primarily to start with, when is that advised, and what should patients know regarding if they are advised an angiogram test? What is it that the doctor is trying to figure out?
Angiogram is usually advised. The patient is saying that I'm doubtful about, doctor, I want to check I want a general checkup, and I'm feeling some dizzy when I'm walking fast, or when climbing stairs, I'm feeling discomfort in my chest. Or as a part of the general checkup, doing a TMT test, a treadmill test, then some ECG changes or the patient is not able to tolerate. In such cases, usually doctors advise for an angiogram in a prophylactic way to find out what is the reason. The other thing is angiogram is usually done when you're going to the hospital and having a discomfort. Usually doctors will do an ECG test. If it is there is no ECG problem, that means it can be an angina, that's coronary artery may be having block, but there is no attack. If the ECG having elevated ST segment elevation, it is called a STEMI actually usually. If the patient is having a doubt about the heart attack, and if your ECG is checking, and if it is increased, they will be taken as a STEMI or attack is already happened. And the other test, that is ECG, will be if you are in pain and immediate attack suspicion is there, it will be done an ECG first, and then if it is increased, then the next test in immediate this thing also, the troponin test. The troponin is one of the cardiac protein, cardiac muscle, it will be oozing out. If you have an attack, that means attack means some of the heart blood vessels are blocked. If it is severe, it's a major heart blood vessel is blocked, you may have severe pain and you may collapse and go into a cardiac arrest and the patient may die. But if it's a small blood vessel, it is blocked, you may not be knowing that, maybe some slight discomfort and you may be ignoring. That is called a silent attack. But if you're having little more and you have, even with a small discomfort, if you're going to the hospital and doing ECG and doing the troponin test, the troponin will be increased within 1 or 2 to 4 hours. It will start increasing if you really have an attack. And the next test which you are usually the doctors will advise, the most less invasive, is the echocardiography and Doppler study. So echocardiography also we will be able to know the major attack is there, or even a moderate attack, there will be the muscle wall will be not be functioning, the heart will be beating. No? So some part of the muscle may not be eating, and the doctors will be able to find it out from the scan itself, that is ultra Doppler study and of the heart. And also the next test is to know, not an invasive test without doing, because this angiography, the regular angiography is called PCI, that is percutaneous coronary intervention. That is it's a risky procedure actually. You'll be usually from the wrist to that the radial artery, and inside that through that the doctor will be introducing a catheter into the blood vessels and reaching the aorta, and the base of the aorta, that is the base of the aorta, there is 2 coronary arteries are going, and in the coronary arteries, right and left is there, each coronary artery entering and injecting a dye and finding and getting the images and finding out. There is so much of problem, because if you have atherosclerosis, and there will be, this atherosclerosis can be taken as small, the skin, you can have pimples, no? Just like there can be pimples that, or small swellings or small bulges of the fat. And if you are going on the way with this catheter, it can poke off some of the places, and it can get that fat, accumulated fat can come out. Just like a pimple bursting, we'll see that there is some white liquid and fatty things are coming out. No, just like it can come. If it is coming out just like that, it will, that blood clot can form. If anything foreign or something is oozing out from the blood vessel, there blood clot, the platelets and the RBCs and clot there, and you will get a clot. So that is also risky thing. So there is a risk is there in this all the invasive procedures. So the most safest way is to early diagnosis point of view, do a blood test. In the blood test itself is now troponin, high sensitivity troponin is there. That is the cardiac damage showing, you will be able to assess. And also HSCRP, that is it's an inflammatory marker, especially for the blood vessels. And in homocysteine, that is also actually, if the homocysteine is high, that is also causing erosion of the blood vessels. And also definitely the cholesterol and triglyceride. More than the cholesterol, the triglyceride and the HDL. If the triglyceride level is high and HDL is low, that means there is so much of fat inside your body and inside your blood, and that will be definitely the chance of getting accumulated in the blood vessel as atherosclerosis and the plaque rupture and all will be high. So if this test, if any of this is high, and even the just weight measurement itself, actually ideally if you have 175 centimeters and you're having a weighing machine, if you are very fit and very muscular, you can have 175 centimeters, mean you can have 75 kg. But if you are a moderately active, only you are doing and the computer and just less than half an hour exercise a day, then you should keep your weight in around 65. That is the ideal. Otherwise, if your more weight means more fat, less exercise and more weight means more fat. The fat content is increasing and your chance of getting heart disease will be higher.
Actually, when we are talking about this angiogram, there is this talk about CT angiogram and MR angiogram, then this calcium score, and so on. So, what exactly should anyone understand when when this talk is about getting such tests?
First, I explained what is the calcium score test. Calcium score is basically a CT scan, and we are measuring the calcification. In the difference between the calcium score and the CT angiogram is in the CT angiogram, you will be injecting a dye into the blood vessel and taking a contrast medium is needed. So in the calcium score, only the calcification, there is no dye is injected. The calcification of the blood vessel can see. So that if there in the CT, there's a calcium score, there is no calcification, doesn't mean that atherosclerosis is not there. Atherosclerosis and these pimples or this fat bulges in the blood vessels will not be able to detect. Only if it is calcified, you will be able to find out that. Actually, this not the usually the the problem this acute attack and all is not because of the calcified blocks. It is actually the non-calcified blocks. That is this calcified blocks are that is also a problem, that is reducing the blood circulation and all, but they are not producing this rupture of the plaque and getting clot and blocking total immediate blocking and acute MI. The chance will be less in that sort of problem. So if you want to know what is the condition of the blood vessel, which is not this calcification is not without the calcification, you have to do a CT angiogram, and for the CT angiogram you have to do the give the contrast. Most of these cardiac patients, they will be hypertensive for a long time and also diabetic and dyslipidemia. This will be having renal problem. If the kidney is already compromised, the GFR or the creatinine is more than 1 or the GFR is more than less than 90, then your damage, this test itself can damage your kidney and you may go into renal failure, or at least your renal function will be reduced. That is a usual thing. After an angiogram, if the kidney is compromised, after the angiogram, the creatinine level will be increased. Even today, I had a patient who was coming, cardiac problem. He has severe, he had an angiogram itself, and they tried angioplasty, and because of the calcification, he cannot do it. They will not be able to. He is advised to do a repeat angiogram, angioplasty, try for angioplasty after a few months, and then if not possible, then go for a bypass. And this patient, actually previously his creatinine level was only around 1 and all. Now it is 1.8. Actually, just one this test, that is contrast injection and this angioplasty, for the trial of the angioplasty and angiogram, they injected to the contrast and it is reduced his renal function. Now they are waiting for the renal function to improve and then go for another angioplasty again with the injection. So it will definitely it can bring down his GFR. Now itself it is only 50 GFR. If another angioplasty and the trying for an angiogram, it may it depends on each patient, and it will GFR will come down and creatinine go up. Most of these patients, this patient also is a diabetic and hypertensive and so many medications on them. So that we have to understand. The risk associated with the testing also. The blood test, you can do any amount of test, only a prick is needed. But ultrasonography, that is also is okay. Now, another test I forgot to mention earlier is the CAMT test. So that you are to get a idea about what is the atherosclerosis level. The heart blood vessels are so deep inside. So the superficial vessels like carotid artery, which is the main artery supplying the brain, which can be easily assessed with the ultrasound Doppler study, and also this ultrasound we can measure the thickness. Actually, I usually advise as a routine part of the cardiac, all the cardiac patients, we ask for a coronary artery Doppler and this coronary intima media thickness, that is AMD. And with that, even we can assess the vascular age of the patient. Even the patient may be only in the 40s, but the patient vascular age may be in 60s or 70s. So that atherosclerosis, the fat deposition is there. There's an easy way of assessing. And also those patients with this peripheral artery disease. This heart patients, it's not only the coronary artery is affected, it is a peripheral artery also may be affected. In that case also we can do a peripheral artery Doppler study also, and we can see that when you are doing the lifestyle changes, you can see after 3 months we can repeat a test again, because it is not having any complication or any side effect, and we can see the opening of the blood vessels. Only thing we cannot do it directly on the heart, because if you are doing it directly on the heart, it will become either an invasive procedure with ultrasound that is also available nowadays. This ultrasound probe is introducing into the blood vessel, and there also the invasiveness and the risk is there. And this dye injection, there is risk is there. But in the ultrasound, the external ultrasound, you can assess, and you don't have to directly measure it on the coronary artery. You can do it in the peripheral artery, and we can see the advantages. You can see the assess the result of the treatment also. If you are doing the lifestyle correction, and you are whether the paying of your efforts, that is also very important to assess.
After an angiogram, sometimes it happens that the patient has a block, and then what next is the question. So that is something like maybe the patient may have an idea that there may be a block and something has to be done about it. But even then, after the doctor tells there's a block, now we have to do something immediately. Or if the doctor says we can wait for some more time, what is it that actually the patient feels?
Basically, the current method of treatment, we can take it different. This is medicine plus lifestyle correction. That is one method of treatment. And next is angioplasty plus lifestyle correction. Third is bypass surgery plus lifestyle correction. And the fourth is, actually this fourth is not commonly available. I don't know anywhere that is the way. Actually, I am expert in clinically supported lifestyle correction for heart problems. So I have treated many patients with all category. Those who are, doctor, I am having hypertension, and my father or family history of diabetes is there, or the family history of heart attack is there. So they are as a preventive, they are coming. And another patient may be diabetes, hypertension, and cholesterol for many years. They may be taking treatment, and because when they gone for a general checkup, this yearly checkup, they found that there is some problem, or this TMG is positive, and they have advice for angiography. And there are other patients who are done and already an angiograph, and there is they tried the prime. This usually along with the angiogram, they try to put the stent also if there is a block more than 70%. Generally, all the hospitals, and depends on the hospitals. Some I had seen those who are inserting stent for 40%, 50% block and all. But general concept is more than 70% block. If it is can be applied, they put the stent also. And there are patients who are not able to put the stent. Even today, I had a patient. Their angiogram was done, angioplasty tried but failed. So then there will be usually advice for a bypass surgery. And I had patients who were advised for a bypass surgery. They also came for this clinically supported lifestyle correction. And I had patients who were already done bypass surgery and many times angioplasty, and there's nothing more to do. And now they have a severe unstable angina, and the stable angina or unstable angina, their activities are so limited, and they are having even difficulty in pain even during the regular work, like taking bath and combing hair, all become difficult. So all different sort of patients I'm seeing and regularly treating. So in generally, all these procedure, the base, whatever is the thing, you had to do the lifestyle correction. Even the latest studies, so many studies are also came out. It all shows that whether you are opting for the here in the our part of the country in Kerala, there are so many cardiologists itself is giving those who are wanting to avoid angioplasty or bypass surgery. The cardiologist itself is treating with the medication. I am getting that. I'm treating those patients under care of such cardiologist also. So in all these things, the base is actually lifestyle correction. We should understand that the heart attack or the cardiac failure, or it is not because of the lack of medication, lack of surgery, or basically it is lack of lifestyle. The problem is the erratic lifestyle, or we are not our lifestyle has changed, but we are not our food habits and other things are not adjusted to that. That is the reason for increase in the heart attack nowadays. So we had to find out, the patient should understand that what is wrong with their lifestyle and what is the reason, fundamental reason for it. And if you are taking medication for actually medication is for only this blood thinners, and statin for the cholesterol lowering agents, and the blood thinners, that is clopidogrel or the aspirin, and the other medications for the diabetes, hypertension, all these things. Actually, there's no clear medication for a heart disease. Only you are giving symptomatic or the test wise. This cholesterol lowering, blood sugar lowering, BP lowering, those medications are only on that point of the view. It is that there's no clear cut medication to prevent, to remove the clot, or the remove the clot. If in an acute attack, there is clot lysis medication also is there. And so what we have to understand, that the mainstay of the treatment is lifestyle correction. And if you can give it in a proper manner, that itself is sufficient. That is what my experience tells me, actually.
Actually, when you're talking about these treatments, generally the feeling is, if there is a block, the patient understanding or the well-wisher's understanding is that block has to be removed. And regarding the attitude, generally it is something like, if it's an immediate danger, then it has to be done immediately. Otherwise also it has to be done, but after a little time. But at the same time, it is heard that, if there is the situation is stable and the patient is stable, this is what we hear. If the patient is stable, there is no issue in waiting for some time and trying to correct it by, utilizing lifestyle methods or medications or whatever else. And that doesn't increase the chance of any future heart attacks more than, doing that immediate surgical intervention, or as earlier said. So how is this to be understood by patients? Because patients will always think, if this was not done, then they are at higher risk.
The patient should understand that the latest study shows that if you are taking medicine plus lifestyle correction, or a stent plus lifestyle correction, or the bypass plus lifestyle correction, the life expectancy is the same. Or to get a heart attack, the possibility of getting a heart attack is the same for all these three groups. So then, if you are taking medicine, anyway, you had to, after the angioplasty or the bypass surgery, you had to continue with the medication. And actually, after angioplasty, you had to take more medicine for the, especially blood thinners and other medications. For a higher quantity of medicine is needed for the next at least 1 year. And after the bypass surgery also, see, these blocks are actually only a part of the block is, it's actually plumbing work. That is, this putting a stent means it's a plumbing work. And some part, the stent is only 1.5 to 2 centimeters length. Only that the spot you can correct it. But your blood vessel is almost 60 miles. Blood vessel is there. It's not the coronary artery alone is affected. The whole body blood vessel is affected. That is why many of the coronary artery heart patients who had a stent and or the bypass surgery, they may having this peripheral vascular disease, and many of them will be diabetic, and they may not be distinguishing. I am between when this when neuropathy and all comes, they think that it is because of the diabetes alone or because of the sugar. No, because it is not because of the sugar. Blood vessels are getting damaged. If you have pain when you're walking, you have pain or numbness or burning sensation, you are finding it difficult to sleep. If you are doing a Doppler study of the leg, there will be atherosclerosis of the leg. Small vessels will be there. And nowadays, not only the stent is applied on the coronary artery, it is applied on the leg also. But the problem is, the stent can be applied, it is only for 1 or 2 centimeters, and it is only if it is the blood vessel is big enough. If there is a major block, you are putting a stent, but after that, that part of the stent, after that part of the small blood vessels also blocked, there is no use. And also, the most important risk is there is a possibility of restenosis and even to get a clot on the part of this stent. If you are not taking the blood thinners in the correct manner, and immediately after within 1 or 2 weeks, and if you miss 2 or 3 days, this blood thinners, you can get a heart attack, repeat heart attack, and a massive heart attack because of the blocking of this major, because this stent is put in a major blood vessel only. So if the attack is coming or the problem is coming on a minor blood vessel, you won't go into a death or major problem. But if you are the major blood vessel where the put a stent, and if you miss this blood thinners, and getting a clot means it can be even fatal. So that we have to understand. Everyone should understand that if you do a bypass surgery, that doesn't mean your life expectancy is increased. If you are putting 1 or 2 stents or 3 or 4 stents, it is not increasing your life expectancy. That is the result of this long stent study I am telling. So what is actually extending your life is the lifestyle correction. So whatever is done, even you take the medicine, if you are doing the lifestyle correction correctly, your life expectancy and the quality of life will be improved. And in my experience, I'm actually, those patients will be having a diabetes, hypertension, all these predisposing factors, the causative factors has to be removed first. I'm not for even diabetic patient. Diabetes is the most common reason. Diabetes and diabetic patient will be definitely, after a few years, hypertension will be there, because the hyperinsulinemia is the reason for the type 2 diabetes. And the hyperinsulinemia will invariably, for a long run, this hypertension will come, because the insulin is a produce sodium retention, and it will give to, and also fat deposit, weight gain. This diabetic medications, all insulin and all the diabetic medications will promote the fat gain, and it will increase the insulin resistance and increase. That's the reason why if you start with the medication for the diabetes, it will be going on increasing. What I understood from the claim, my experience and my so much of from the experience from the patient result. So it is very easy to correct the insulin resistance and blood sugar without the medication. I'm seeing these patients who are advised with many 20 years, 25 years, type 2 diabetes, hypertension, dyslipidemia, all these medication, and advised for bypass surgery, or had a stent many times. All these patients, I'm able to reduce, taper off the medicines within a month. And diabetic, if it is a type 2 diabetes medicine, that when we start the clinically supported lifestyle correction itself, we stop the diabetic medicines, insulin injection. Why? If you are taking with a really correct low carbohydrate diet, if you take such medicines, you will get a hypoglycemia. Hypoglycemia is more dangerous than a hyperglycemia. So, and if the patient is following, because it is a very clear protocol is there. If the patient is following the protocol, the patient within 12 to 24 hours, blood sugar will be under control. So that is the pattern. And within a week itself, the BP started reducing. Only thing, when those patients who is taking clinically supported lifestyle correction, if they are on medication, especially the this cardiac medicines, that nitroglycerin. Nowadays, I am seeing so many patients with 2, 3 this blood vessel dilators. That nitroglycerin group of medications are there. So such patients, if according to the BP is reducing, if you do not reduce the medications, they may get giddiness or dizziness, and the BP fall can. So in the initial stages, only thing we have to monitor the blood BP. It can be done at home itself, and reduce the medication, and clear direction will be given on reducing the medication as per the reduction in the blood BP. And the cholesterol can be initially we follow up with every weekly cholesterol and the lipid. It's not actually the cholesterol. We give more importance for the triglyceride and HDL. And usually the triglyceride, those statin, according this within a week itself, most of the patients the triglyceride will come down, and that statin level will reduce gradually, and the BP medicine also gradually according to this thing. So it's a simple only thing the patient should have an understanding about it.
We discussed on the aspect of angiogram and then putting stent and all that. Also regarding this bypass, the issue normally they say is, bypass is done when, one stent or two stents is not practical, and it's having a systemic sort of failure. So, but in spite of doing bypass also, just like stents, we hear that sometimes these bypass patients are found to be again advised bypass once more. So stent also and bypass, this repeat requirement is happening. So what is wrong with the approach towards these patients, or what is wrong with the approach in general that is creating a situation where the same patient is treated for the same problem again and again?
This modern medicine actually, these things are in the last few decades, these are come. And now it is very clear that previously we were thinking that the statin will give every, when the statin is first came to the medical field, everyone thinking that all the problem with this heart attack is because of the cholesterol. And there is a cholesterol lowering agent that is very effective also. So everyone in the medical field were thinking that it is preventing the heart attack, and we are getting this miracle medicine for the heart attack. But it is very clear that there's no use of much use is there, because many patients on heavy cholesterol, anti-cholesterol lowering agents, and even this their cholesterol is very low, but heart attack is coming. And the stent, the multiple times stent is applying, and the once the stent is doing, then again stent, it is continuing, and one by bypass. And there are many patients who, if it is possible, the doctors will advise more bypass. But the problem is the bypass risk. You have to bypass surgery. You have to have this blood vessel. So it has to be taken from your leg or the hands or your chest wall itself. So everything there will be a compromise, and you should understand it is not a small bypass surgery. Is not a small surgery. You have to cutting open this sternum, the chest bone itself, and to that this all the ribs, the rib cage is attached to that, and it is cut and opened, and the pericardium is opened. Then you are in luckily the heart blood vessels are in the externally. It is running on the external. You might have seen the pictures of the heart. And so you are doing either this internal carotid arteries, that is the two arteries are supplying your this chest wall from the anterior, and that will be separated and taken. It is given to the heart, it's heart part where it is blocked. The problem, if it is both is used, your compromise, it will the healing. If it is one is used, body will adjust to so many ways. That is why we are able to do all these operations actually. So if it is both the internal carotid artery, internal mammary artery is used, the healing will be get affected. So it is very good, because it is actually, it is only one bypass, is only, it is taking, it's from the aorta, it is from the aorta, it is stitched to the, yeah, after the block. But if the small blood vessels also is blocked, what is the use? There's not much of use in that. So, and also the blood vessels from the leg is also taken. So it will actually giving scarring there, and many of the patients may be having, these patients may be having atherosclerosis of the leg, and also the varicose veins. So there is compromise is so much. Even if you are doing all this great effort and you're having all this pain, but your chance of getting extended life expectancy, or reducing the chance of second additional attack is nil. That is what the latest studies are showing. But many of the patient doesn't know that. That is why they think that the people are thinking non-medical, this layman is not reading any, this lot of studies and all, no one is looking into. Only the doctors is knowing. So you should pay the people also, because it's all, there are so many interests and so many controlling factors and all is there. So each patient should, before you undergo the bypass surgery or the stent, you should also try to find out what is the benefit, what is the risk, and such things you should find out the real risk. Even this unstable, you are talking about the unstable and stable angina and all. When the patient is unstable, and if you are doing a procedure, especially the stent, angiogram and angioplasty, the risk is very high. 3 to 7% chances even death is there. That also we should understand. It's a interventional or elective angiogram and angioplasty is much more safe. When the patient is in pain and in the problematic problem stage, there is also risk is there. So all these things patient also should understand.
Actually, when we are talking about these issues of intervention, Generally, the common concept is that if this surgery or this intervention is done, the problem is taken care of. Uh, at the same time, we now hear that the problem is not taken care of. It is basically the symptom that is really taken care of. And in another way, if it's a emergency like an attack and all that, of course we understand that that takes care of that immediate issue, immediate aspect. But why do you think patients fail to understand that this procedure is what is done in the hospital, and the correction in the cause of it has to be done at home? Why is it that you think patients fail to understand, other than the few patients who actually look at it in a more wider perspective?
What I see is usually after the bypass surgery, the people will be more sensitive about their lifestyle correction and all. Or after stent, putting the stent also, they are not that much bothered about it. Because it's a minor procedure, didn't have much pain. But after the bypass surgery, usually people will have really more conscious. Actually, that lifestyle correction is actually giving benefit. It is not the bypass surgery or the stent, putting the stent is giving benefit for their health. So now also the current trend of the globally, the trend is to treat the diabetes, type 2 diabetes also with the medication and the insulin. So actually, many, because all these treatment protocols have started many years back, and we were not knowing the real cause for all these things. And when we were 100 years back, we got insulin, and we started. And then at that time, we do not that what is the difference between type 1 diabetes, type 2 diabetes. We were not, medical people also was not aware of. Now we have very clear knowledge that why it is why, how the type 1 diabetes comes, and how the type 2 diabetes comes. But the management is given the same. Only thing that tablets is not effective for the type 1 diabetes. That is the only change we have really putting in. And the people, and even the many of the senior doctors doesn't really know that the difference between the type 1 diabetes and type 2 diabetes and the insulin, that what is the role of insulin in producing these blocks. That is because everyone is confined to their own specialty. So only those who are treating that part, they're looking into that. This actually, the endocrinologist is only knowing about this insulin. The cardiologist is not looking into the what is the action of insulin, what is the insulin resistance. I have not seen any doctors is looking for this insulin level. Everyone has a routine like the cardiologist. I'm saying cardiology prescriptions and all from the Kerala and also the neighboring states, and even from the US and the other foreign countries also. But no one is looking into the insulin resistance, and no one is trying to reduce the insulin resistance. If the insulin may be 200 and the maximum it should be 25, and ideally it should be around 5. That is enough actually. If the sugar level is normal and if you're managing, that much insulin is enough. But it is almost 100 times higher in many of the patients. And they will be having all this fatty liver and finally into the cirrhosis. Actually, this insulin, the basic cause we are not addressing, because there's not a medicine for that, and doctors doesn't have any thing to give for stopping the insulin resistance. We have medicine for reducing of the cholesterol. We have medicine for reducing the insulin, reducing the glucose, but there's no medicine to reduce the insulin resistance and reduce the insulin level. That's the patient's responsibility. That if you control your calorie intake, and if you can do the exercise or physical activity, then it naturally come down. And the most easy to correct also with the lifestyle correction, the insulin resistance. Actually, we check the insulin level in the after 7 days itself. On the 8th day we check, and it is definitely 90% of the patient, 99% of the patient, it must be come down. But the cardiac patient, everyone, it will be very rare case of arthritis and all. Sometimes it will maybe, but as a general, within a week itself, the insulin level will come down. May not be the normal low level, around 5. Within a month, it will be, if the patient is managing correctly, it will come down to around 5, 6 and all.
Actually, we hear that almost 90% of the heart attacks have something to do with the damage to plaque. That is, either plaque is eroded or there is a plaque rupture and all that. But at the same time, we understand that none of these procedures in any way protect against that plaque rupture or plaque erosion, other than for a specific place or something like that. Sometimes it is done. So, what is it that really the patient should know about this plaque rupture or plaque erosion? Because when they are considering their heart health and the procedures that are done for that.
Basically, as I said earlier, this putting in the stent is a plumbing work. It's a bypass surgery, is a plumbing work only. Actually, the heart is having this, just our plumbing system is there, and also the electrical system is there. For the heart, the pumping has to correctly, there is nerves are there. There's a heart itself, there is a cardiac skeleton is there. Inside that, it is very protectedly placed this nerves. See, irregular heartbeat, that is one of the major thing, and arrhythmia, that is ineffective heartbeat actually. That comes and going to the cardiac arrest with the massive heart attack is mainly because of this lack of blood supply to the major nerves actually. That this pumping is, this muscle action is taking place only because of the nerves activity. If the nerves is not getting enough blood circulation, it will go off. So that is actually creating this sudden cardiac arrest and death. So within 10 minutes, if you're not able to bring to the hospital or revive the CPR or revive, the patient may go into coma. Even if you are able to restart the heart, the brain may be dead. That is why many of the people are taken to the hospital. All the possible things are done. This pipe, angiogram, angioplasty, everything is done, and patient may be in the ICU for 1 or 2 months and then pass off. So that is one aspect of it. So what we have to understand is, when you are having a heart problem, the most important time is not when you're getting a heart attack. So definitely, if you are getting a heart attack, you have to go to the hospital, stabilize the patient, and immediate this clot, if it is lysing of the clot is needed, it has to be done. But or if there is a clot is there, we can definitely put a stent and open up the blood vessel within 2 hours. That is the ideal time for opening up, so that the muscle can be, the cut muscles can be served from avascular damage. So those things we have to do. But remember that whatever you do, you have to do the lifestyle correction and come out of the predisposing factors. Not only the smoking, alcohol. You have to come out of diabetes, hypertension, and cholesterol. You should be able to control it without medication. So I'm telling it confidently because with my experience, as I said, if the patient is willing to follow the protocol, actually I call it a cell activation protocol. CSLC we call it actually. So with that, we can, with evidence, with the clinical monitoring, we can come down, and you can, I have seen patients with the HbA1c 13, 14, with the maybe taking medicine and so many hypertension medicine and 13, 14 tablets, different type of medications they are taking. And most of the cases we'll be able to, almost all the cases, I have no failure actually on the treatment or the protocol side. Only the patient may fail and they may not be, because of so many family problems or so many hesitancy, they may not be able to. That is also very few only, because we are selecting the patient in such a way that they are really interested in this clinically supported lifestyle correction and come out of medication. Such patients, actually within a month, they'll be free from all the medicines. Only thing, if they have put a stent already. If I had patients who had put a stent last month and they want a repeat stenting or a repeat bypass surgery is needed. If the stent is put, then you have to take the blood thinners for an year. Otherwise, the repeat clot formation can be, that is because of the treatment induced, because the stent is a foreign body is there. It has to get covered with the blood vessel lining itself. Till that time, you have to take the blood thinners. Otherwise, and also one more group which is an exception, that is those patients who have put this pacemaker. inside. Actually, we are thinking that the pacemaker is put on the chest. Actually, the leads, that wire is given to the heart, cardiac chambers. So in such patients also, they had to take the pacemaker is put lifelong, this blood thinners has to be taken, anti-clotting agents has to be taken, otherwise it will be risk for the patient. All the other patients will be able to come out of the medications. Only while they have a stress, they may have to take because of the stress level is increasing, hypertension, or when you're eating high carb diet once in a while for enjoyment also we can eat. In that time, specific medication also is given to not to increase the blood sugar. And our aim is actually bring down the HbA1c to 5.5 and blood pressure level to around 120/80. And many patients complain that the fourth medication already was taken for the BP, but now some are telling that my BP is going down, doctor, only 110/70 or 160 is there. So that is the normal BP. That is possible without medication. Even those patients who are taking many years antihypertensive, they can come down. They can come out of diabetic medicine. And also the cholesterol. Actually, we are not trying to bring down the cholesterol much. So in the Indian, especially in our part of the country, it is around 200 to 240 is a normal cholesterol only. But the triglyceride has to be kept below 150. That is, we are giving importance. And also HDL level. It is keeping HDL level and the triglyceride in the normal level. The cholesterol level, we are not looking into it. It's only with the statin you will be able to get the very low. Some cardiologists will keep it LDL below 100, and such things it is only artificially created. But we should understand that if you're taking such a high dose of cholesterol, the patient may be very tired and muscle pain, and the sexual dysfunction will be there. That is the major side effects of the cholesterol. And also, these people will start feeling dementia. The memory will be reduced because the cholesterol is very essential for the functioning of each cell of the body. The integrity of the cell is kept with the cholesterol. So if you're blocking the production of the cholesterol with the statin, it can have many consequences, and it may not, because so many millions of people are taking these heart patients are taking cholesterol, but they get repeat attacks. So it's a general. We can simply logically we can understand that it is not the cholesterol alone is creating problem.
There is a general understanding that just like plaque, rupture of it or erosion of it is primary cause of heart attack. Similarly, there is a general understanding that inflammation is the primary cause of plaque rupture or erosion of the plaque. So, what is it that a patient should understand? That what is it that the treatments give the patient with respect to managing this inflammation? Because when you look at it, it seems that inflammation is what is to be managed. Inflammation should be controlled. So how does angiography and angioplasty and bypass and other surgical procedures help in that?
We can take this plaques, pimples. This young teenage people, they get pimples on the face. Just like it is when it is ruptured, when it ruptures, when it is mature, it will rupture and it will come out. That pus, this fat tissue. Actually, it is only lipids actually inside. That is the pimples is a formation of this sebaceous glands. That is oil producing glands. Just like pimples, it is inside the blood vessel, and when it is increased in size, it can come by rupture. It's just like the pimple is ruptured. When the pimple is ruptured, we have seen that there is blood is also coming out, and the blood blood will also come out because the blood there is an inflammation, and then what will happen? There will be clot is formed inside. So it is actually going to produce that clot is actually when it is blocking the blood vessel, you get an attack. That is the simple, just like this. Can consider it's just like pimples inside the blood vessel, and it can rupture, and it will give a massive attack or a mild attack or a unidentified attack. Depends on the size of the blood vessel. When we consider about the inflammation, how this bypass or stent is reducing, whether it is reducing inflammation? No, actually, it is increasing the inflammation. If when you're putting a stent, the procedure itself is inflammatory, because when any foreign body is introduced into the body, the inflammation, the body's defense system will be activated. When you put the stent, the inflammation and clot formation will be very high. So that is why initially the uncoated medicated stent, initially the first generation stent was a failure. So the patient will get the clot on that and attack can come. Then we discovered this coating it with the anti-inflammatory agents. So now there's only the anti-clotted stents are used. Actually, even absorbable stents, at the time absorbable stents was used. So it also is increasing the heart attack and recurrent repeating. The blocks are very high, so it was taken out from the market. This absorbable, that is now we are using this the stainless steel sort of stents. Actually, it's a foreign body, so it will definitely increase the inflammation. And also the bypass surgery, how much inflammation we are introducing, because you are cutting open. Only you are able to do it only because of the anesthetic techniques. You are able to put the patient in under anesthesia, and the patient is not knowing the pain. Can you imagine without anesthesia opening your chest wall and doing some, and it's almost 10 or 15 centimeter long incision on both the legs most of the time to harvesting the blood vessel, and also your the chest wall blood vessel is taken out from there, because for the surgeon it is no problem, because they are expertized in that. Your chest wall is opened and the internal vein artery is taken and given it to other place on the saphenous veins from the leg is taken, and put, and actually it's a vein we are using for the bypass. So it can be reblocked is very common. The most effective is actually the internal mammary, that is artery itself, and only one part is already attached there. So minimal intervention is done. So that is the best actually for the artery. But you are compromising your own system, your chest wall, your breathing. The breathing, that is the heart muscles, is definitely needed. Also your breathing muscles, you need the respiration also. They are supplied by these blood vessels. See, basically, it's if you are willing. I want to convey is, if you are where the inflammation is the basic problem, it's all inflammatory disease. None of these surgical procedures is reducing the inflammation. Actually, it is aggravating the inflammation. Medications are anti-inflammatory. That is one or way or another way. It is reducing inflammation. This clot formation itself is an inflammatory procedure. So it is this blood thinners are anti-inflammatory. But we should understand one more thing. That when you're taking a medicine, anti-inflammatory medicine, it is actually blocking your healing mechanism also. That is why in the clinically supported lifestyle correction, we try to reduce the taper of the medication at the earliest, but with the only with the evidence, with the test report and the symptomatic relief and the test report, we reduce the medication, because all these anti-inflammatory, almost all the medicines we are using one or way other way, it is anti-inflammatory, and anti-inflammatory medicines will, it's a parallel pathway, and inflammation and anti-inflammation of the body is the healing mechanism. The healing mechanism also will be blocked. That is why we try to come out of the medication, not only because of the it's to get the patient, repair the body. Actually, we are in the clinically supported lifestyle correction. What we are trying to do is to repair your blood vessels, repair the heart muscles, and to make the natural anastom, this bypass. Our body has tremendous capacity to repair it and rebuild it. And there is actually 7 years, that is the time of rebuilding. Every day, every minute, the cells are changing, we are changing. So we make use of that and make it possible to repair your body. So you can have new blood vessels to come, and we can see it with the modern medical diagnostic techniques. We can see it so if you want to study the coronary artery itself, you have to go some invasive procedures. But you can check the same thing in the peripheral artery, and we can see the changes in your symptoms itself. The peripheral artery opening up of the leg arteries, and the carotid artery, the plaque thickness of the carotid arteries, we check every 3 months actually for this carotid artery. And also that gives an impression for the doctor also, the evaluation of whether the patient is doing it correctly.
You often say that the heart is the victim of other lifestyle diseases. Why do you say that?
Basically, heart disease just doesn't come as such. It is actually a progression of the other diseases. Like usually we call it as metabolic disorders or the inflammatory disorders. So most common is as a result of the diabetes, hypertension, or the cholesterol or the dyslipidemia, and the obesity. So the heart blood vessels are getting damaged. This coronary artery is getting damaged means all the blood vessels in our body is getting damaged, not the coronary artery alone. So when the blood sugar is increasing, why the blood sugar is increasing? Because you are eating more than what you are needed, or whether you are eating more than the body can process. So for using to reduce the blood sugar under control, metabolic chemical activities in your body has to you are eating, and the body the whole thing is going into the nutrients are going into the absorbed nutrients are going into the liver, and liver is processing it, and essential immediate use it is distributed, and the excess is stored as glycogen or the fat. If you are eating more and more fat is made from the carbohydrate itself, or even you're eating more oil. Nowadays the oil consumption is also very high. The oil is not actually in the oil fries alone, it is in the form of this nuts and seeds also is containing very high content of oil. Almost 40 to 60%. In many of the nuts, almost 40 to 60% is oil itself or the fat itself. So this excess has to be stored in our body. And because now recently our lifestyle, there is not of much physical activity, but the food is plenty, carbohydrate and the oil seeds and the oil consumption, everything is very too much is there, and the food is relatively cheap also, especially the processed food is very comparatively cheap also in many of the part of the world, only in the Africa and some part of other countries in our part, even in the very poor sectors of the society, the obesity is so common. That means that plenty of food is there. So this excess food, when it is coming either in the form of carbohydrate, it has to be converted into fat, or in the oil seeds and the fries and all, it is again has to be stored in the body. So when it is not, the fat cells are full, then what will happen? The blood, this fat will be circulating in the food form. That is actually we measuring as the lipid profile. Actually, this HDL, LDL will tell. You always say that the LDL has to be reduced, no? So LDL means that is actually fully loaded drugs of the. In a form it has to be the fat is insoluble in water, so it has to be made in the form of the soluble form. So it is made in a, that is called this with the lipoproteins. It is lipids and protein in a mix. Lipid means the fat. So it is in a mixed in a form, and it is made in a truck to transport it. So there is no place to deposit. So this fully loaded trucks, that is LDL, is plenty in our body. And HDL actually is empty trucks actually. HDL means the high density lipoprotein. There the fat content will be, the fat density is less, no? So if it is removed, it will be called HDL. And if it is fully loaded truck, it is called LDL. The other is HDL. So if the more HDL is there, they can catch the fat from anywhere from the circulation. The whole body is, each cell is supplied with the blood. So from anywhere it is excess, it can be taken back. That is why HDL has to be normal. LDL has to be reduced, but many of this test also, it's all many years old tests actually. So it is not really this the empty truck and loaded truck. We are not. It's all indirectly measuring. So and also this calculation depends on the this triglyceride level and all. So there can be you cannot take it just like that. So what we should understand that this disease, each disease is creating this dyslipidemia is actually giving these plaques. And for that, this insulin is increased. So there is, when the hyperinsulinemia is there, the development of plaque possibility will be high. So there is no other option. So we have to understand that the problem is in our food. That is the other diseases. The heart is getting damaged, coronary artery is getting damaged, just because of the other diseases like high cholesterol, means not more than the cholesterol, high triglycerides circulating in the blood, the high sugar, and above all, the insulin level is high, and the total excess fat deposition and inflammatory process.
Actually, when we are talking about this situation, Yeah, whether it is diabetes, as you mentioned, whether it is hypertension, whether it is high lipids, or whether it is even autoimmune disorders, all of these seem to have some way of encouraging heart disorders. What is it that patients, when they are having a heart problem, normally they will see all the other problems as minor? So generally they tend to focus totally on the heart and how to solve that. So in such a situation, what is it that patients should understand when they have a heart problem and they also have other comorbidities?
If you want to escape from heart disease or the future attacks we have, or maybe having already attack, and whatever surgeries or stent or bypass surgery, whatever you have done, it is not curing you or preventing you to get another attack. That everyone should understand that. The primary cause of your disease, your heart blood vessels are getting damaged, is the metabolic disorder. That is high triglyceride, high amount of fat in your blood, high amount of glucose in your blood, insulin in your blood, and also stress. Stress itself is actually producing so many hormonal abnormalities. Like this cortisol level, the steroids, when you're having stress, so much of hormones, the steroid hormones they're all actually adding up for your problems. So what the real treatment, the real solution is to bring down these hormonal parameters and also the metabolic parameters to normal. Yeah, but what we are doing is actually putting a stent, doing some plumbing work, or doing a bypass surgery, and again increasing the inflammation. And we are thinking that we are giving a false confidence that you are getting treated. But here, it's only a symptomatic relief you are getting. That for a short time, the real relief has to come from your change in the lifestyle. You should, the diabetes has to be corrected, not with medication, because 90% of the medicines are increasing the insulin level. The root cause, insulin resistance, is not addressed there. You are 90% of the insulin itself is used for this patients who are having high insulin and insulin resistance. So you're pumping. I had seen patients. One lady, I think she's only in 40s, 44 years old. She had undergone a bypass surgery, and after that she came to me. She's diabetic, and for the purpose of they were not able to control her blood sugar, so they put that this insulin pump for getting control of the blood sugar during the surgery and post-operative bleeding. And actually, she was very uncomfortable with the. See, you should understand that insulin pump is a costly item. But she was uncomfortable because of this, with this, and some complications arised. And when she came to me after 7 months of bypass surgery, I think. And she removed it before coming into this insulin pump was removed, even though with this, so much of effort and money they have put it inside. So, but her problem was not recovered. She was very tired and she put on weight. After the surgery, again put on weight. So, the making you more problem actually. After the surgery, with this insulin pump, when the insulin is there taken, you will be feeling very hungry because this hypoinsulinemia and hyperinsulinemia. You cannot, a person who is on diabetic medicine will not be able to control your food intake because of this natural hormonal and the insulin level changes and the your sugar level changes. When the insulin is in, sugar will go low. Then you feel hungry, and it will be repeating itself actually. So what, and also this blood thinners when they're you are using after the stent and all, your blood thinners also, the aspirin, clopidogrel and all, is acidity inducing. So you will be feeling you're hungry. Actually, you're not hungry because of the acidity. You feel the abdominal pain that you take it as a hunger. So that is what we have to come out of this medicine, control the lifestyle, and come out of the medicine. There is the only way out from to protect your heart. And I'm maybe the patients may be thinking that how I'm 30 years taking diabetes medicine or aspirin I'm taking, then how can I come out? And is it possible? It's very simple and it is possible with my approach and my protocol. It's a diabetic. If it is a type 2 diabetes, we stop the diabetic medicine in the first day itself and see. We can check the blood sugar after 2 hours itself. You can see, nothing has to be done blindly. You don't have to believe anything. You can see it or experience it. There is no need for believing it will be effective. You can be very confidently check it and see what is happening in your body. And nowadays in our part of in India, that is the major advantage. Here we don't have to, if you, it's very freely available and the tests are very economical. Even in the treatment also, we check the HbA1c and all weekly. Usually once in 3 months, HbA1c is checked. And because we are confident that HbA1c, if the patient is looking into correctly, HbA1c will come down within a week itself. So that is the level of confidence we have. I have because of my experience. If the things are not going properly, it is only because the patient is making any error in the system, or they didn't understand it properly and find out that it may be very difficult to find out. And you have to check what they are eating. So in that we are actually understanding what they are eating, what type of exercise they are doing, everything under control. Then only it is clinically support lifestyle correction is really the patient's lifestyle is under control, and for the at least for a 3 months period. And actually, we are distantly monitoring. Not you need not lie down admitted or anything. We can say at home itself you can take. But the only thing, you should have an understanding and you should be willing for it.
Actually, you also tell normally that obesity is a major factor as a comorbidity for heart problems. And you tell that this fat, especially in our part of the world, because it is at the belly fat sort of situation, that it is a place where constant inflammation and actually it's like a toxic area in the body. So you always tell that for all the treatments, generally you look at body composition and see that reduction in body fat is one of the primary goals generally to treat. So what is it that patients who have, because it's a very sensitive issue, because telling a person that your fat itself is something like body shaming and all that. So how is it that patients should understand in case a doctor tells that you have to reduce weight?
Most of the patients will be coming to me. There are underweight patients and normal weight patients also get heart attack and heart problems actually. But now my patients, what I see is even though they are in the lower normal BMI, around 20 or 21 or 19, also the fat content will be excess. If those who are having this cardiac problem. And the tummy fat, that is the visceral fat, is high. The visceral fat means that not only the tummy, all the internal organs will be covered with the fat, and all the blood vessels and the nerves will be accompanied in a tunnel sort of thing, and it will be covered with the fat. So fat is everywhere. You think that our brain is controlling and our body and all. Actually, when we come to the micromechanisms or the molecular biology, it is actually the fat is controlling everything. Even the brain is made of mainly fat. That the muscle is, we think that everything is made of protein. It is wrong. Actually, the muscle is made of, a prominent thing is the protein. But our brain is made mainly of fat. So the fat is even the psychiatric problem that is very common. It is a cardiac problem also is more common in psychiatric patients especially when those who are taking medications. That is because the psychiatric medicine also increase the obesity, chance of obesity. This diabetic patient with the medication, if the diabetes patient without medication, then they will not gain much weight. So with the medication, the weight gain will be higher. So actually, we should also think whether you are taking medication for the type 2 diabetes is really harming you. And the insulin level is going and your fat deposition is increasing. With the fat increase and accordingly, that the insulin resistance also further increasing. Insulin level also is increasing. So, and also you will be having a false confidence. I am taking medicine. I don't have to do anything. So they'll be having a relaxed because you're basically with this lifestyle disease, you're taking medicine. Actually, you are fooling yourself. And you will not be, because of the medicines, you will be confident I'm doing everything correctly. So I don't have to do any lifestyle correction. That is the attitude. But if it is actually, we can also see that previously when there is no medication, there was diabetes was there. But after all these diabetic medicines come, only the type 1 diabetic patients, definitely it's a boom. But for the others, about the type 2 diabetes, actually it is not actually, maybe the life expectancy is increased not because of this lifestyle disease medicine for the or this antihypertensive or the other medicines. That is because of the reduction in infection and antibiotic and vaccine and all, that is general lifestyle expectancy is increased. But here, with all these medicine, even the very young, even I'm saying that the reports of 18 years, 20 years, 25 years, 30 years, all sudden heart attack and dying. So that means we have really, everyone should understand that. And also those who are on the continuous medication, starting very high dose antiplatelet medicines, everything, we are again getting heart attack. And those are undergone many times plastic angioplasty, again it is coming. And after bypass also the same. So we should understand that the real problem is you have to correct the lifestyle. You have to come out of the lifestyle diseases. There is only this that only a localized plumbing work or can be done with the thing. And also one more thing, when we are thinking, and I'm seeing so many patients with arrhythmia and anti-arrhythmic medicines, or the missing beats with the ECG, also some irregular beats, and also if lifestyle correction, that can also get corrected. It's also automatically that is also getting corrected. That is the most important thing. So whatever, even that, finally those irregular heartbeat, missing heartbeats is going ending up with the pacemakers. And I had seen the patients who are coming at around 40 years and only they're put on pacemaker. And many medicines actually, there'll be those who are having this also, they'll be taking some medicines to reduce the heartbeat also. The problem usually, this pacemaker is put when your heartbeat is very low. And such patients is already on beta blockers, like which is will be reducing the heartbeat also. If it is the patient, if you are willing for a lifestyle correction, then if you are able to diagnose the irregular beat, or even if the patient is in a reasonable health, we can repair the heart. We can repair the heart not with the medicine. That you should understand. You have to repair the heart with your correct nutrition and correct lifestyle, and reducing this inflammatory fat from your body and building up your muscles. And actually, this hormone milieu and everything is getting corrected. It has this myokines and the osteoclast, some hormones from released from the bone and muscles are there. So they have an important role in maintaining our metabolism. That's all. These are the latest understanding, but all these understanding are not put in the lifestyle correction. That is what that lacuna we are trying to fill up, actually, to correct it in a systematic and proper way.
We talked about diabetes and hypertension and high lipids and obesity and all. But you also often mention that autoimmune diseases are also a major issue with respect to heart disease. Like, for instance, rheumatoid arthritis or psoriasis and all that. You generally say that, both the disease and the treatment, both actually sometimes increase the chance of heart attack and cardiac problems. So what is it that actually this autoimmune disease patients of arthritis or psoriasis and all, what should they know about it?
Autoimmune disease generally, it's a big group of autoimmune diseases called rheumatic disorders. Rheumatic disorders are collagen vascular diseases. Actually, collagen vascular. Vascular means artery. You should understand that. That is rheumatoid arthritis, rheumatic fever, all, and even scleroderma. So all comes under this collagen vascular diseases. Collagen, for understanding that, we should understand, we have a basic understanding. These blood vessels are made of the collagen, and the protein used for it is collagen and elastin, main protein in that. So collagen vascular disease means all this, or most of the autoimmune diseases comes under this, especially affecting the joints and the connective tissue. This is a connective tissue. It's a part of the connective tissue. It's everywhere actually. So our immune system is acting against it. It is trying to attack the collagen. So if it is attacking the collagen of the joints, you get the arthritis. If you are attacking the collagen of the skin, you get psoriasis or scleroderma. And because when you're asking about this autoimmune disease, I had few experiences also, I can tell. I had a patient, she's a lady actually. She's only in the early 40s, after 42 years. When she came to me, she has already undergone bypass surgery. She's diabetic, hypertension, and so bypass surgery. She came to me after 4 months after bypass surgery. And when she came, she mainly came for the scleroderma problem. She's having an ulcer with the scleroderma means skin also is, it's a type of autoimmune skin disease. But it will be affecting the heart because her heart is already affected. That is why she needed a bypass surgery. And she's very painful ulcer on her leg. And for that, she came actually. And after she's not very obese or all, but she's in the early obesity stage also. She was, after putting her in the CSLT camp, this clinically supported lifestyle correction, She was not only she was able to heal this scleroderma ulcer, her main problem. She's coming here for that, but she was come out of all the medications for the heart disease, and also her diabetes was gone, diabetic medication and all the medications. Within usually that is our norm. Usually, if the patient is also controlling, doing accordingly, within 3 months, within a month, they will be able to come out of almost all the medicines except this blood thinners for the stent if it is applied for an year, or the pacemaker, this blood thinners for the lifelong. All the other medications we can come out. Another patient was similar, this autoimmune disease, I remember that his problem was he's also come for the heart problem. He was asked to do a bypass surgery after an angiogram, and his blood vessels was very small, so he's also very young, around 40s only. He was very, his blood vessels are very small, so he cannot go for a stent insertion. So he was advised for a bypass surgery, and he's having some discomfort always in the chest also. And when we come to the history, he's having very big keloids are there. Keloids means it's not only on the wounds, it is many chest. This area is this sternum full of this thing, and also big bulges are there. That is fibrosis, actually, skin fibrosis. This patient also, for him, it will be very difficult for this bypass surgery also, because he's already his keloids are there in the full on the chest. And also, if the keloid patients, if an wound comes, that fibrosis can multiply. So a huge problem it will become. Anyway, this patient, this small blood vessel reason is this autoimmune disease. This keloid is an autoimmune disease that is affecting the collagen. And also, so that is what I want to convey. This, for these patients, those patients who is having a keloid, there is no medicine. They cannot be removed, even surgically removed. That can be also a big problem for them. So such patients also is getting comfort, and the keloids is not completely good, but it is reduced in size, and the itching and the discomfort was reduced. And another thing is like a psoriasis and rheumatoid arthritis or the psoriatic arthritis patient. The problem is we are using for the symptomatic relief, they had to use the steroids and so many other medicines. When they are using steroids, automatically the blood sugar will go high. So the diabetes medication has to be started. So naturally, most of the diabetic autoimmune disease like psoriasis, arthritis, etc., they'll be on long-term steroids and such anti-inflammatory agents, and their weight will be increasing, and the diabetes will come. So it all adding up actually. I have so many patients with this multiple problems. Psoriasis will be the, or psoriatic arthritis and the heart problems, everything. So the thing is, if you are correctly guiding that, you have to correct the immune system. That is your basis actually. Immune system is controlled with the omega-3 and 6, and immune system is controlling everything. And the heart disease itself is an immune inflammatory disease. All these autoimmune diseases are of inflammatory disease. So your immune system's excess inflammatory response has to be corrected. So we have to go into the molecular medicine, and the fundamental thing that has to be corrected. And the most important thing and most satisfying thing is it is possible. So only thing, the patient has to make an understanding, and they have to think in a different way, because the common medical system is going into another way with the pharmaceutical solution and the surgical solution and pharmaceutical solution. But we are not looking into the fundamentals of the life manifestation itself, or the life science. You had to so much of improvement in the life science. We have so much of understanding, and also so much of diagnostic procedures, but it is not using in the medical the treatment in the, especially in the treatment, patient is not able to access it. So, and also the simple protocols for that, that is we are able to correct. And if the patient is willing for that, even the weight reduction, if the patient is willing to use a low calorie according to our protocol, around 20% weight reduction is possible within 3 months. That itself, not with a rehabilitation center or in a hospital background, is in their own house itself. They'll be able to, if a person who's having 100 kg, they'll be able to come down to 80 kg around. It's all depends on the patient's effort also, but that is very common. So that is what I get, around 15 to 25% weight reduction. I had patients, but around at least 15%. 20% is a good, that is distinction patient. That is the thing.
Actually, in this final question on these comorbidities, what I think the viewers would like to know is, for a patient or a heart patient, what is it that they should understand about their kidney health and liver health? And similarly, for this liver or kidney patients, what should they understand about their heart health? Because it is generally understood that if you have a problem with the kidney or the liver, then your medications and everything, has to be looked at very carefully, because medications normally don't help the kidney or the liver.
Most of the heart patients who are advised for the bypass surgery, especially because if you have bypass surgery, they'll be having definitely their renal function will be low. And for example, one patient he came from South Kerala, Trivandrum, I think, and he's advised for a bypass surgery. He has tried to put a stent, but it is because of the calcification is possible. He was advised to try one more time for putting a stent or go for the bypass surgery. And he's already his renal function is around 40, GFR is 40, and his creatinine is come up 1.8 or something like that. That is after, because he has already tried one this by angioplasty. The contrast is injected. Contrast is a big problem for the kidney. Everyone should understand that before going for a angiogram or angioplasty, definitely look for the GFR. GFR is the most sensitive marker. And if the GFR or this urine albumin, if it is high, definitely you should understand that you may not go into renal failure if it is the GFR is around 80 or 70. But definitely some of the basic unit of the kidney is nephrons. Some more nephrons will die off. And all these patients who are advised will be having this excess cholesterol, fatty liver, triglycerides will be high, fatty liver will be there, and many will be in the stage 2 or fibrosis. And another patient, I think, that here having a stage 4 fibrosis also. That is, he's also came for the heart problem actually. And he's mainly worried about this, more than that heart problem, he's worried about this liver problem also. That patient also is having, most patients will be having some compromised function of the kidney, compromise in the liver. So, and also they'll be on many medicines. That any medicine which you are intaking is damaging your liver and kidney. That is basic. May not be putting you directly into renal failure. That is only rare cases. Like some antibiotic and some medicines can put you failure also. And even this contrast dye injected for the angiography and angioplasty. Some patients you can go into a failure itself. But some patients only the function will be reduced. But gradually with all this medication, you will end up with the renal failure. And even nowadays we are seeing very frequently this liver failure also. And along with the liver failure, even one patient I remember 2 days back, when the heart patient problem is there and also liver problem with ascites, that means the end stage of the liver disease. So if the two systems are failed, it will be very, very difficult. So we should not wait for the system to fail. You actually early diagnosis and correct. You don't have to wait for a heart attack. If you have obesity, if you have diabetes, hypertension, come out of it. If you don't want to go to heart attack or cardiac arrest and death or premature death or stroke or debilitating problems, you don't wait for it. Just correct your lifestyle diseases. Start from the obesity itself, or it may not be for the Indian or the Asians. If you have a protruding tummy itself, you should be careful, and you can get anytime. You should remember that you can get a heart attack. You are prone for that.
Actually, it is said what is good for the heart is good for the brains. So, what is it that patients should understand that about the relationship between heart health and the brain health?
Heart health and brain health and liver health and all the body's health is going together. Only thing we have improved, basically give importance for the heart. Why? Because if the heart is not pumping, your life is gone. So we are worried about the heart. If your heart is healthy, only your brain will be healthy. Your most important, the primary, your food is processed in the liver. If the liver is healthy, only you can have a clear blood vessels. The road, this transport system is the blood vessels. The heart and blood vessels actually the working as a single unit. It's a closed unit. Heart pumping the blood into the blood vessels, and then the veins are taking it back to the heart. That's all. So if the heart and blood vessels is healthy, only the other systems will be healthy. So don't wait for the heart to fail, but the arteries to get atherosclerosis and the fat deposited in the blood vessels and get it break, and the plaque to break and make a clot, and the myocardial infarction and heart attack to come. just in the beginning, actually, in the latest understanding is that when you're born itself, your atherosclerosis and fat deposit is starting. Only how fast it is going. Or you may be having atherosclerotic plaques is there. And whether it will rupture or not, it depends. When your pimple is coming, whether it is break can come out, or it subsided there and become a small calcified nodule, or it will just absorb by itself. It all depends. So it can rupture. If it is rupture, if it is in a major blood vessel, you can go into a massive cardiac, massive heart attack. That means major part of the blood vessels or the nervous system is affected. You can get into a cardiac arrest and die on the spot, or you may not be able to reach the hospital. Or even if you reach the hospital also, major heart attack, you may not be able to survive. That is the thing. So basically, you start from the causative factors, your protruding tummy or the obesity or the hypertension. The hypertension is only because of the blood vessel is already damaged. If you have hypertension, you should understand that your heart is all over. Your blood vessel is not dilating. And for the comforting message I can give you is that 99% of the cases, this diabetes, all these things, if you are in the correct way, if you are modify your lifestyle, you can come out of all this, and you can protect not only the heart, your brain. If you are coming out of this heart attack risk with the correction of your predisposing factors, your stroke risk also will be reduced. But if you are continuing with the medication, especially this aspirin and this clotting factors, your risk for hemorrhagic brain stroke is increasing. That also you should understand that. Everyone is taking aspirin. If you have a small hit itself, you can get a brain hemorrhage and you can go into stroke. And even without it, the stress, when the BP is increased and your blood vessels is already damaged, you can get a hemorrhagic stroke.
What is actually lifestyle correction, and what is the difference with clinically supported lifestyle correction?
See, lifestyle correction, when we think about the lifestyle disease, heart attack, diabetes, hypertension, all comes under lifestyle diseases. But basically, lifestyle correction, everyone talk. But till now, there is not much of the efforts was taken on clinically supported lifestyle correction. So monitoring the patient with the clinical support and the clear guidance, that is actually was missing till now. So where my effort is mainly on give a correct guidance and support for the lifestyle correction, and see what are the results and how the heart or how the blocked vessels are clearing up. So generally, people have people is the current scenario. The heart attack means immediate angiography, stenting, or if it is not able to put a stent, go for the bypass surgery and go continue the medication lifelong. That is the norm or the current. So if you want to understand, if you every heart patient or everyone who is worrying about heart disease or who is already on medication with the heart problems, listen throughout the video, then only you will be able to understand. So otherwise, it is very difficult because the current norm is going for the angioplasty and bypass. That is the current norm, and continue the lifelong medication. I'm telling you how you can not only avoid bypass surgery or doing an angiography or even doing an angiogram, angioplasty, or even to come out of medication. For the current patients, generally they use the medication. What medication which is actually given? It is only the medication for the cholesterol, blood thinners, and the diabetes. For the causative reason is actually diabetes and hypertension, and medication for controlling the hypertension and diabetes. That is the usual norm of the patient, and most of the patients will be having many other diseases also along with that, other than this diabetes, hypertension, dyslipidemia, that is cholesterol. So listen carefully and see. You should think yourself, why I am taking all these medicines, why I am going for the surgery, what is the benefit I am getting out of this undergoing this major surgery like bypass, and what are the disadvantages of this, and what is the problem with the fear, what are the negative factors or the side effects of putting a stent. So each patient should understand these aspects also, because understanding about the disease and also the treatment, it is necessary for the current scenario of protecting your health. You have asked about the difference between the lifestyle correction and the clinically supported lifestyle correction. The difference between is clearly, if usually the cardiologist will say you should reduce on calorie, control your blood sugar, and take medicines correctly. That is the usual advice given. And you may be getting a prescription from a dietitian about two slices of bread or two chapatis and this much portion advice and all. But in the clinically supported lifestyle correction, we go into the root cause of why this heart, what is actually heart block, is the accumulation of fat and sometimes the calcification of the plaques, that is the fat. Fat depositing in your blood vessels internally, just like it can be considered as a pimples on the bump on the your skin, the pimples. Just like it is inside the blood vessel, it is happening. It is no more in a smaller sizes may be small because it is the small organ. So that is the only difference. It is actually when you get a heart attack, when this pimples rupture, there may be heart pimples that is not showing any oozing out tendency or breaking. So that they are much more stable. So it just like that, this pimples inside the blood vessels also, it can be, it's small, can be creating problem. Usually stent is applied when it is more than 70% or 80% block. But usually the block, 80% of the attack is coming because of the rupture of these small pimples inside the blood vessel and forming a clot around that. So here in the clinically supported lifestyle correction, what we are doing is to clear these pimples inside the blood vessel, or this clear these fat deposits inside the blood vessels and making it stable. Just by reducing the inflammation, the food has to be changed. And also, why this blood problem is happening, why your blood vessels are getting damaged, it is because of the excess glucose and the triglycerides. There is a fat running through your blood. It is actually the excess fat and the glucose inside your blood is creating this problem. So we had to correct that first. So that is our focus. Actually, in clinically supported lifestyle correction, it is indirectly to correct the heart or the blood vessel, removing the block. We correct the blood itself, the values inside the blood itself.
So it is very interesting from what you said that the person who has a heart problem should do his best to understand what was it that caused his problem. So it is very easy for anyone to say that just like anyone else, I also have gone fat or have got BP or diabetes, and then I got an attack and that's it. And unfortunately, most people never try to find out what went wrong and why they got an attack. They are more concerned about, if they have had an attack, they are more concerned about how to get it fixed. Of course, fixing is one thing, and prevention of another attack is a totally different thing. So doctor's view is that if you want a fixing of an attack, then you have to look at it at one way, like you need a procedure or a stent or whatever it is. But if you want to prevent another attack, then you have to learn how to do it. No one else can give it to you in the form of a pill or a procedure. This is what I think you have meant. So the next question is, see, there are especially in our state of Kerala, there is a lot of developments in the health field in terms of new hospitals and large centers of excellence and all that. So what is it that these patients should know is the difference between centers of excellence and clinically supported lifestyle correction?
See, center of excellence for any disease, not only for the heart, that is a place where you can reverse the problem. It is not fixing. So for a patient, for a heart patient, once an attack has occurred, or in the family there is a history of heart attack, and when they took a health checkup, this TMT is positive, or the patient is having diabetes and the family history of heart disease or hypertension is there. If you can say, it's in the correct sense, a center of excellence is a place where the patient can be free of the disease and free of medication. If you are taking, you cannot call a diabetology clinic where it is treating with insulin for a type 2 patient or medication, it is not it cannot be taken as a center of excellence at all, because you are not getting disease free. If you are putting a stent or a bypass surgery or the center of excellence in the modern medical field, it is center of excellence by its equipments basically. So if the patient, if there is bypass surgery, cardiac open heart surgery facility is there, it is called. And then the next level, if it's a cath lab level, if they have latest lasers to describe this atherosclerotic plaque, it is called a center of excellence. So all the center of excellence in the general term, it is the more and more sophisticated equipments are available. Medicines is always available for everyone, but for the centers, because it is very costly equipments, so it will be there only in the few hospitals. But in our part of where I am practicing, when I started practicing, there was no centers in 19 actually, and I came to the medical profession in 1981 and completed by after almost 8 to 10 years of uh, this training is there. No? So only even after 10 years, there was no bypass surgery or stent application was taking place. But for the last 30 years, there are in most of the even each district is having hospitals with the center of excellence, like all the cardiac facilities. In my city, in Cochin, it's a small city actually. Here itself is, I think, 4 or 5, maybe more than that. Many hospitals which have this so-called center of excellent facilities are available with all the lasers, rotators, and bypass surgery. All is available. But we should understand that if we can really be a center of excellence, we can reverse the condition, and you can avoid the bypass surgery or a stenting. That is possible with this clinically supported lifestyle correction. That is the advantage of, that is the importance, because it is a new stream or new development. Many are not aware of it. That is why we are actually, I'm interested in describing with this interviews and all. I'm interested to more and more people aware of it, then only you will be able to come out of it. Even for example, I can tell you that one of my classmates recently passed away, and when we had a meeting for his after that, and one of the classmate, he's also a cardiologist, and he's telling that he had undergone two bypass surgery, and 2 or 3 times he had already put stent or had put a stent, but undergone two surgeries, and he was diabetic, hypertensive, and all, and obesity also is there, and passed away. Even after two bypass surgery and many stent applications, he got a heart attack and passed away. So the people should understand that it is not the answer is that not you got the problem not because of the lack of bypass surgery or a stent or multiple stent or nothing. It is the reason is your lifestyle problem and your high triglycerides in your blood, high blood glucose in your blood, and it is making your blood vessels stiff and making the heart work more, because the dilatability of the blood vessel is lacking because of the damage created by the toxins. That is, glucose is the basic toxin, and the triglyceride you're eating excess. So that has to be corrected, and along with that, so many nutritional deficiencies also. So that has to be corrected. And if you are really focused on the correct scientific nature, or you understanding the science of the human body and try to correct it, that is the answer for that. That is simple. It will actually be simple, and you need not go for a, unless it is an emergency or a clot is there immediately, you need definitely care in the ICU, and you have to stabilize your heart and the blood, all the parameters. Then definitely the next step is correcting the lifestyle and do it in the proper manner.
Actually, what we understand is that in case you have an emergency situation, these centers of excellence are really useful. But to prevent a second occurrence, there is nothing that is more important than what you do for yourself. That is how you correct yourself and see that a second recurrence is prevented. From what doctor often says regarding heart attack, that either a person is having a heart attack or he is creating conditions for a heart attack, or he is creating conditions to reverse an heart attack. And to make it more simpler for our viewers, you often say that, if you're going to a medical facility, the primary situation, that is, if you're having a heart attack, is to get over that. But otherwise, the most important thing that you should be doing is reversing the conditions for the next attack. So, in this context, what is it that you would like the patients to know? Because they may have already suffered an attack, but then regarding the future, also regarding stent and bypass, having multiple blocks, the normal understanding is you put one stent now or two stents now, and after some time, if things go worse, you can put another one or two stents or more, or whatever it is. Similarly, for bypass also, they say that you can do the bypass now at a planned bypass, because bypass is never usually an emergency, but a bypass now, and if things don't go well after some time, you can do another bypass. So this option is always available for more stents and more bypasses, because we have very good centers of excellence. But whether you require more stents or more bypasses, that is something that you can learn when you're, I think, hearing from what doctor is speaking about.
See, I have treated in all level of patients actually, like those who are having little diabetes or hypertension and cholesterol or the triglyceride is high and on medication, or without even starting that, because of the family history, father had an attack or something like that, or the brother had a recent attack and passed away. They come for the treatment without going before an attack. And some others are coming after going for a health checkup. They done a TMT, that is the usual thing doctors check. And in that there is some exercise intolerance is there, or TMT was positive, and go ask for a CT angiography or an angiography itself. And they found that in CT angiography or a calcium score scan, so much of deposit of calcium is there, or in the CT there is angiogram, there is a block, or in the PCI, that is the golden standard, doing it directly, putting a stent and injecting dye and seeing that block is there. Or usually while doing the block, they'll try for putting the stent also, the intervention cardiologist. And they tried for the stent but not able to put the stent, or the position of the block is not in a favorable position to put a stent, then they will ask for a bypass surgery. These sort of different stages the patient come, and also they have undergone once or twice the bypass surgery and done stent already, and now there is nothing can be done. The cardiac function is very low and the output is low, only 27% is there. Now there is nothing can be done, only for going for a heart transplant. Heart transplant, it is not easy, So there are so many patients who are having this pumping is reduced, and but there is nothing can be done. I'm waiting for the or usually doctors, it is not available though. So the heart is not available for that. It is not no one can donate, a living person cannot donate a heart. So the kidney you can donate, but the liver, part of the liver can be donated. But the heart you cannot, only for the cadaveric or the dead person it is, or the dead person also it is not fit for it. Only the brain death patients, the accident and all, brain death patients. So it is very rare for a transplant. But I had treated such patients also. It was only 27% or 25%. So if the patient is willing for the correction and taking the correct nutrition in the correct format with correct exercise, the cardiac patient cannot do much vigorous exercise or anything. Gentle exercise, especially I'm giving it in the lying down position. It's not in lying or sitting position, not even standing. So a person who can walk can definitely do those exercises. And that is the pattern. And everyone, then initially they will be very worried, fear, if I do this. But gradually they will come up. And you can see the difference also. It is not blindly we are doing. When we are starting the patient, we will be checking all the parameters and all the cardiac markers like troponin, HSCRP, homocysteine, of course, this lipid profile, and even the advanced lipid profile parameters like lipo and things. And we follow the patient, what is the difference also. And also this with the ultrasound scan itself, we can see how much of fat deposit is there, especially in the neck vessels and the peripheral arteries in the neck vessels and also the leg. So we can see the opening of the blood vessels itself. Many of the cardiac patients will be having some atherosclerosis of the leg also. They will be having pain and all, especially those who are already had undergone some bypass surgery and all. Their blood vessel also must have been taken from there. And so the pain, leg pain after walking, they have that half pain also. So such patients also can be corrected, and you can see only if you believe, only when you are experienced. The CAD patients, many, and also I'm seeing many comments below the video also. How is it possible? Is it possible? It is possible. Only thing, you have to understand it and go accordingly. And to treat the patient also, I should have a very good thorough knowledge about the patient's current body parameters, the organ status, not only about the heart, the kidney, liver, everything you have to know, and also the patient's lifestyle and also food habits, and correct accordingly. So it is difficult, but it is when it is put in a protocol and it is applied in the correct way, it is very simple. But it has to have certain. The patient also should understand that for the bypass surgery, patient has nothing to do. The insurance will pay generally for the cost, and also patient has to only undergo this surgery, and the pain, you have to suffer the pain and the discomforts. That's all. But here it is entirely different. You have to understand what is wrong with your lifestyle and should be willing for the correction. That is the only thing. So if you are able to willing for that, the correction is very simple, and you can see the result also changing. Not only you are avoiding a surgery or the cardiological interventions, you can come out of the medication also. Otherwise, you have to continue all your medication for the diabetes, hypertension, and all. Usually, my patients will come out of all the medications for the diabetes, hypertension, dyslipidemia, all within a month itself. And it has to be, simply you cannot. Just we are not stopping or tapering of the medicines just like that. It's all with each every week we will be checking and accordingly. And then after it is corrected and stopped the medicine also, we will be continuing checking till at least 3 to 6 months follow-up is there, and that is sufficient. And the patient will, by the time patient will learn.
Actually, from what you have mentioned, basically the patient has a very major role in preventing another heart attack, even though they have done stent or bypass and all that. But at the same time, you also often say that stenting. Many patients think that putting a stent is primarily for preventing heart attacks. But if you look at it carefully, stenting has a very small role in preventing heart attacks, and also it is said that almost all heart attacks happen where blockage is less than 50%, while stent is put when the blockage is more than 75% or 85% and all that. So what should patients understand about this angina and prevention of another attack?
Angina is actually the pain when the heart is not getting enough blood circulation. Just like when if you're having the atherosclerosis of the leg, if you walk for a thing, you get the leg will start paining. Just like the heart is pumping for, if you want to walk, the heart has to pump. If when you eat to digest the food, heart has to work. So when the heart is not able to, or when you are stressed, you need more blood for more activities. Are the pumping will be, the heartbeat will be go up, and then the heart will find it difficult to, the muscle will not get, then you feel the pain there. If the heart is not, heart blood vessels are not giving enough blood, circulation, blood to the nutrient, to the cardiac muscles, then the pain is felt, and it can be referred to your shoulder or your cheek or your jaws, or to even to the left hand, you feel the pain. So that can be stable angina or an unstable angina. Unstable angina, it is actually, there is not, only if you do a angiogram or angioplasty or bypass surgery, only you are opening up one block, major block. But if the block, then if the patient is very severe angina and all, they will get a relief for the time being, for a short time. But the problem is why these patients, the latest study shows that if you put a stent, or you have undergone a bypass surgery, or you are only on taking medicine, the repeat attack possibility and death because of a second attack is the same, or the life expectancy is same for all these three groups. Because, as you said, it is not the major 80% blocks is creating the sudden attacks and death. And actually, this 80% or 90% or 100% block also is there. Then the body is able to get time to circumvent the problem by making more new blood vessels to supply the heart. That is the reason that many people who is having 100% or 90% block also still alive. The death is happening because of this plaque rupture. That is happening in this 40%, 50%. And the studies also shows that 80% of the rupture is happening because of the, or more than 80% is happening, it's not in small, less than 50% blocks. So that is actually, that you can get at any time if you are doing a vigorous exercise. Like when you are doing an activity in the gym, where youngsters doing physical activity and exerting, it can stimulate the rupture of the thing. And also, if you are doing it a stressful situation, there may be someone maybe speaking in the public speech, or when you are hearing a bad news of a close one's death. So then you can get the attack. That is because that time that plaque can be, because the heart is beating higher and because of the multiple factors, that plaque can rupture and a clot can form and the blood vessel, even the 50% blood vessel is blocked, only block is there, 50% the flow is there. But because of the sudden bursting of this fat molecule or the pimple inside the blood vessel, and the clotting mechanism is activated, and the blood vessels, a small blood vessel is totally blocked. That is the place where you get an attack. So prevent that, you have to correct your lifestyle, you have to correct your glucose count, you have to correct your insulin level itself. Actually, insulin, these type 2 diabetes patients are generally hyperinsulinemic, especially when they take after postprandial, the insulin level will go high. That is actually creating problem. So we had to come to the root cause. See, only in the cardiology point of this putting the stent and doing the bypass is only a superficial thing. You have to come to the root cause and correct the root cause, which is creating all this problem. So if the patient is able to understand the root cause and how to correct it, only you can escape from the second attack. That everyone should understand. So that is why I'm telling everyone to clear this whole, actually it's a 5-session video, and you have to start from the reason, then the latest treatment methods, then to the comorbidities associated, that is the other diseases which is the creating this heart problem or damaging your blood vessel, and then what is the role of clinically supported lifestyle correction, and also we'll be discussing the results also. So you can go, then you will, if you are patient enough, you will understand what is it, and then you can make the decision.
Actually, from this, we understand that when a patient is informed after an angiogram that they have blocks of certain types and all that, and multiple blocks or so, and there is a need for a stent because the blocking is relatively high, or from other tests they also know that they require a bypass and all that. Normally, all these patients, they will be focusing on their heart issue because that is the life and death matter for them. So in this circumstance, what is it that you would like to let the patients know? Because you always say heart attack is usually most often caused by other lifestyle diseases. So if other lifestyle diseases are so important in causing these attacks, what should patients know when they get treated? Because normally, once they hear this issue of their heart, they will forget everything else.
Basically, everyone should simply logically think over. There are people, many of the people are advised for the bypass surgery or advised to stent or angiography. They're not doing it, and they do the lifestyle correction, and they're living a long life itself. I'm seeing so many patients like that. They have been advised, but they have not decided. They are gone for the lifestyle correction. And other type of patients who's undergoing the surgery, bypass surgery, or the putting stent, and they are getting the repeat attacks and dying also because of the repeat attack. So what is the difference? And then there are people otherwise also they are put a stent or bypass surgery, but they are also living a long life. After 10 years, 15 years, they are living. Those who are they're doing the correction of the lifestyle, they are getting a long life. That is, so medical field also it is accepted fact that it's the many studies are there. So most important is the lifestyle correction. And many people who is taking all this aspirin and clopidogrel and so many medication for the heart, they won't be, and the diabetic medicines, they won't be able to do the lifestyle correction in the proper manner because they'll be having so much of stomach problem. If you and also the insulin, hyperinsulinemia and hypoinsulinemia. When you take insulin, it goes hypoinsulinemia, and after you when you eat food, it will go to hyperinsulinemia. So both is actually damaging, and both is actually when in between you will not be able to, the patient will not be able to do the lifestyle correction or the food control in the proper manner, and they'll be always tired. The patient who's taking BP medicines and all these medicines, they'll be always feeling tired. That is, I'm always seeing patients who are talking very tired and not able to do anything. So they are not in a fit position to do the exercises also. Or that is the reason for it is this problem is continuing, and you are on lifelong medicine, and lifelong will not be able to do the corrections. So here, the correct lifestyle correction itself will be able to make you free from medication. That is the most important thing we are doing. It make you free from the medication, and now it is possible with this. What I'm doing, I'm doing it is with a clear protocol, that is cell activation protocol with a special CAP diet. That is, we call it as CAP, and the diet was specifically called it as a CAP diet. And also the exercise, we call it oxyflex exercise actually. With that, we can come out of and all the medicines. And if you have diabetes and hypertension also, you can be cleared. So that is the important. And only thing, it is the people may not be able to believe it when you are hearing it. That is why I am asking the people who's in looking for the solution for the heart disease or diabetes or hypertension, or looking for prevention of another attack, go through the videos. There are so many videos on this heart attack, and also the mechanisms describing this, how this repair of the activity and how the immune system is acting on this, how the immune system is helping. Actually, you should confidence in having your own immune system. That is the repair mechanisms. The blood, the clot, this fat deposited in your arteries can be cleared by no one else, the laser, or has only very minor part. But your immune system has the capacity. So believe in your own immune system, your own healing power, and activate it, and go ahead with the correctly understanding to how to help your immune system. And then if it is not too delayed, it is you will be able to. So if you're one or two, if you are having heart problem along with the kidney failure, then it is difficult. More than one organ, two organ is failure, especially in the late stage of the failure, then you will not be able to. So act early. So if you are in the early heart problem, even if you have put a stent or bypass, it is okay. You can, there is, if you are able to walk at least slowly, then you are, and your kidney is okay, and you're not in the late renal failure like stage 5 renal failure and heart problem in the stage, then we will not be able to help you. But otherwise, if it is in the early renal failure, also stage 2 or 3, it's okay. Along with the heart problem, you can come out of all the medication. Only in special circumstances like you put a stent within a year, then you have to continue this blood thinners to prevent the complications associated with the stent. If you come before the stent, putting the stent, or after, or after 1 year after the stent application, you can come out of all the medications within a month itself. That is what my experience. But it is the effort of the patient also, and the willingness and understanding of the patient also is very important.
Actually, from what we heard just now, basically, what we understand is that the patient's understanding of what the treatment is doing for him or her is primary requirement for success. The patient should understand what a stent is doing for them, or what the bypass is doing for them. It is that fine understanding. It is not that I am getting an operation done and my health is getting okay. It is much more than that. You have to really understand what is the end result of such a procedure. Then only you will be able to compare it with what doctor was telling regarding clinically supported lifestyle correction, because then you will be able to judge for yourself what is the plus and minus of both the conditions and treatments. Now, you were often saying that creating health is the first step to reversing heart disease. Actually, when you mention creating health, you say that creating health is not like doing a surgery or doing a procedure or doing anything like that, but you have to create the health within the patient. So what is it that patients should understand when you are saying create health first, so that your disease can be reversed? Without creating health, your disease will never be reversed.
Create health means you should have an understanding, and you have a disease. So there is many of the cells are damaged. The heart patients, the blood vessels itself is damaged. When you talk about the heart, the blood vessels of the heart or the supplying the muscles of the heart is damaged. So not only the blood vessels of the heart is the blood vessel actually is almost 6,500 kilometers, 65,000 kilometers. It's the length of the blood vessel. So not only the heart blood vessels, the whole body blood vessels will be affected. So your brain blood vessels will be affected, the kidney blood vessels will be affected, your liver blood vessels will be affected, and your leg blood vessels also will be affected. So many of the whole body is affected, not only the heart, but the heart is very important, because if the heart stops, your life is finished. So you had to repair your blood vessels, and for repairing that, you had to give enough nutrition. And the nutrition is used, actually it is the immune system which is the healer in you. The real doctor, whatever is done, whatever procedures is done, the real healer is your immune system. In the bypass surgery, you are making the chest, cutting the chest bone and opening it and doing the surgery. And who is actually healing this wound? It is the immune system's effort, is the healing. So if you are cutting and opening the heart, and even the cardiac membrane, that is the pericardium, also is opened, and it can heal after this. If the sick person who's already heart and blood vessel is damaged, if after that this major surgery, the wound can be healed, then why not this your own immune system can remove these blocks? So you should think in that way. And if you have confidence in the immune system doesn't have anything else other than the nutrient. And also the toxins to be avoided. The excess toxin actually is making an inflammatory and making this calcification and all is because of the inflammation. So the balance of the inflammation and the anti-inflammatory activity has to bring it. So all the medicines which is using in the current medical system is anti-inflammatory. One or other way, even the statin or the other medications, or one or other way, it is actually blocking the inflammation. So the medication which is blocking the inflammatory activity will block the healing system also. That is why the clinically supported lifestyle correction, we try to come out of this all medications to promote the healing. You have to and support the anti-inflammatory activities of the immune system. So if you can do it in the correct way, the immune system will act for you. And the real doctor is within you, and believe in that doctor, your own immune system, and support the immune system with nutrition, avoid toxins, and improve the circulation by planned and segmented. When you are a heart patient, you cannot do all the activities, and you should very segmentally, part by part only, you can stimulate and do the exercise, and you will be able to clear your blood vessels, from the blocks.
Actually, it is very interesting to understand that no one talks about the immune system and heart attacks together. Everyone is concerned about heart attacks as if it's a question of blocks created by high cholesterol, high triglyceride, and all that. But what doctor has very specifically shown is heart attacks are very much related to our immune system. The overactivity of immune system is creating actually a setup like plaque, and then the the control of that activity prevents over inflammation and causing heart attacks. So from what doctor has said is very crucial for everyone to understand, that the immune system has a major role in heart attacks. So can you actually explain that this plaque formation is something like development of an immune response, and then control of that, that is controlling inflammation, is a basic necessity to prevent heart attacks. So what should patients really understand? Because everyone knows that the lifestyle has a lot to do with the immune system of the body, and no medicine, no procedures actually are able to directly influence the immune system as much as lifestyle. So what should patients know about their immune system and heart attacks?
We have medicines to influence the immune system. That is actually this blocking the immune system or suppressing the immune system. That is actually all the medicines. We know that at the end stage or when we are very seriously sick, we use steroids. That is the directly blocking all the inflammatory activity. Actually, medicines other than only medicine which is supporting the immune system is vaccines. So it is trying to memory and all. Everyone knows that vaccines are actually increasing the immune activity or to prevent a disease or infection. It's only point of view of the infection, and also this antibiotics. Here also it helps immune system to fight the germs or the disease causing agents. So these two medicines, actually these two medicines, these vaccines and the antibiotic, that is actually was a boon for us, and it is actually this life expectancy has increased because of these two only. And also the painkillers, even the anesthetic medicines, that they are all actually this blocking the, it's a pain is the manifestation of the immune system, that is the defense system. Immune system has two wings, this defense and the healing. It is a manifestation of the defense system, and we are with very effective medicines, we are able to block the aspects. That is why we are able to do the surgery. If you know, we cannot, we are conscious or we will be having pain. Actually, we are making it unconscious and removing this pain senses as such. That is why we are able to do the surgeries. It is very useful in the case of an accident and or wound to getting the stitch or getting operated, but it is most misused in this sort of lifestyle diseases. So we are going on, because you can put into anesthesia and you don't feel the pain, you are misusing the medicines actually. Maybe that the technology itself you are misusing too much. And if and also the diabetic medicines, actually this one of the major reason for this plaque deposition itself is hyperinsulinemia. And but the patient is already, I have seen many patients where insulin level is so high, 25 250 300 and all. They're taking every day one insulin jab also. So that insulin is actually promoting deposition of the fat inside the blood vessels. So many is not aware getting, because these all protocols are fixed for a long time, and this changes in the understanding of the lifestyle, this micro mechanism or the molecular mechanisms, no one is aware. Doctors is trained not in the molecular medicine or the molecular science of lifestyles. No one is training in terms of where our training is basically how to use the available medicines, and that is the medical developers, the pharmaceutical companies who are the conducting the studies. They'll be giving their guidance, and also this medical equipment manufacturers are making that, and they're giving the studies, and according to their instructions the doctors are working. So there's so much of limitation in that, and understanding about, because of so much of specialization, the patient should understand that the limitations of the patients, the doctors, and also the hospital system, and also the pharma and the this equipment manufacturers, because they are working on the focus of that. But you should have a holistic view. You should the whole thing you should be able to. That is very difficult. I understand that with this busy life, a techie or a businessman will not be able to study all these things and make a decision by themselves. Then so they submit themselves to the professionals. But one thing one should understand that no medicine can reverse. Till now, there is no one can claim also the medicine or the surgical procedures can cure you or reverse a disease. Unless the surgery can, if you have a fracture, it can be fixed with the surgery and all. Even though there will be limitations in that also, the healing, final healing has to come from inside you. So empowering the immune system and understanding the immune system most important. And you had to understand that everyone knows that about the immune system and immunity and all. You had to understand the role of immune system in correcting the heart attack or the blood vessel block. You should understand it and empower your immune system to come out of that.
What is it that happens when a patient is able to avoid a stent? What is the background of such a patient, and how do you think that has improved his future possibilities of his heart health?
Definitely, that is the most common scenario in my center, basically in my clinic. And many patients come, they have been asked for a stent and they wanted to avoid. And I can tell you a few examples about that. And this is one example is this is a 49-year-old man. His height is 170 centimeters and weight is 71 kg. Not much overweight or anything. But he had a sudden chest discomfort and taken to the hospital. And he was it was a ST segment, STEMI type of clear evidence in the ECG itself there is an attack. And immediately he was put for the primary stenting, and they were able to the angiography. There were three vessel disease. All the three vessels were having atherosclerosis and blocks were there. And they were able to, because his condition, because already a massive attack was there, so he put only one stent and asked for a phased stenting. After a few days, when he is more stable, they will put one more angiogram and angioplasty. That was he was advised. And while he was in the ICU, he was able to watch the videos, and that is why he came to me actually. And after 3 days, he was put on another, before the second angioplasty, when an echo was done. In that echo, there was some clots inside his heart chamber. That is, apical clot was there. So the doctor said, because there is a clot inside the blood, this thing, it is, we will wait for 1 month and then put the stent. So after getting discharged from the hospital, he came directly to me. And when we look into his blood parameters and his case records from the cardiologist itself, was clear that there is a massive attack was there, and he was on heavy medication. His main complaint was he's very tired. He's feeling very tired, and so many medicines was there, clopidogrel and divabrant, this apixaban, that is to clotting, because he has already put a stent. Already the heart clots are there in the heart, so he was on blood thinner heavy dose, and ivabrant, flavodone. Those are cardiac medicines, and spironolactone, telmisartan, and metoprolol. So many medications for stopping, controlling his BP, and atorvastatin for controlling cholesterol, high dose 40 milligram, and tortlip and the metformin and vidagliptin and dapagliflozin. Three medicines for the diabetes, and also insulin twice a day. When we look into details of its health problems, his diabetes for the last 10 years and taking medication for that. And his creatinine was also after 1.2. That means he's already in the grade 1 renal. Basically, kidney also is affected, and maybe because of this long-term diabetic patient. And also fatty liver is there, and BPS, that is prostate hyperplasia is there. And he is complaining of this penile strictures, and also that is it's a very rare disease. Actually, it is not diagnosed before, because after the ultrasound scan and all, we have diagnosed an autoimmune disease called a peroneus disease, actually, because of this. That is, I'm not going into the other details. Actually, we'll focus on the heart itself. Actually, we are treating the patient as a whole, not the heart alone. So that is why we are looking into all the parameters, and when the blood test itself, he was showing the insulin level was so high. He's diabetic and taking insulin injection. And this insulin level itself is creating his problem. Insulin has a problem. One is give a sodium retention. Sodium retention means the hypertension. That is why many of the patients, after diagnosing and starting treatment with the for the diabetes, they, even though they don't have the hypertension, they will get a hypertension eventually. Because most of the medication for the diabetes is actually oral tablets are increasing the insulin level, many of them. And also you're putting type 2 diabetes. If a patient is type 2, it's type 1 diabetes means there is the pancreas is not producing any enough insulin. But type 2 diabetes, the pancreas is working, and many of the patients, the pancreas is overworking. So this patient also, pancreas is overworking, and along with that, he's taking injections, so his insulin level is very high. Actually, this insulin level not only increase the BP, it will create damage the blood vessels by making the endothelial dysfunction. It is nitric oxide, that is a vasodilator, and its production is blocked. So that is the reason this cardiac patients, this diabetic patient go to heart disease. And also this glucose is damaging. Glucose is definitely damaging the blood vessels, and endothelial damage is happening. Along with this, insulin also is damaging. So the disease, diabetes itself, and also the medication is acting against the blood vessels and damaging the heart. That is the reason for this heart attack for this diabetic patient. And also when the BP is increased, the heart workload of the heart is increasing. So there will be so many mechanisms. There will be the cardiac muscle hyperplasia, that's so much of a heart muscle, so it needs more blood, but the blood vessels are getting narrowed. That is the reason. For this patient also, this is the same. The problem is he is having hyperinsulinemia, even with that also the HbA1c is high, and even the other PSA also. I'm not going into that parameters. So many other problems also was diagnosed. That is he's having some autoimmune condition also. That is with this young age, he's getting a heart attack because of this autoimmune problems, which is promoting the clot formation. That is why he's having a clot inside the heart also.
Actually, you are telling that this patient had multiple issues and all. And you also are telling that you treat the patient as a whole, so that it is not only the heart, but other issues also that are. So you are mentioning about this high insulin levels also. But patients generally, when they come for a heart problem, they normally don't bother about the other diseases and issues and all. But how does actually, what should patients like him know that if their insulin level is high, it is actually affecting their heart, and the chance of attack and all is very high actually, when you compare it with other issues. And what is it that can be done to lower their high insulin levels?
It is very easy for me with this my CSLC cap. That is what I call for this this treatment method itself. In this with it has two aspects. One is the diet, and that we call it is a cap diet, and that is the diet is for stimulating your immune system, and also the exercise pattern called oxyflux, that is also finally focusing on the immune system itself to correct your body and correct your body parameters and the macro level and at the micro level and at the molecular level, and reverse the disease. Actually, for him, actually this his insulin level, we checked the blood sugar at 4 times at home itself, and he was able to come down. His when we are coming, he's starting even with all this insulin, and he was under pakka because after that attack he was very worried, and he was under control at home. So the diet and all was under control, even though his HbA1c was 8.8, and his HbA1c came from 8.8 to 8.1 within a week, and his insulin level was, and by the second visit it came down to 7.7, that is 15 days, and his insulin level actually only after 30 days. Nowadays I check insulin level every week itself. It's sometime 2 years back patient actually. So that time only, but actually the insulin level comes down very fast. Just like when you are in the correct diet, blood sugar can be controlled without. Actually, you should mind that you should understand that we start this type 2 diabetic patient. We stop all the insulin, diabetic medicines and insulin injections. All the three diabetic medicine and insulin injection the first day itself. But in the first day, within 24 hours, his blood sugar was under control. And the insulin level also, if you check in the after the 8th day itself, insulin level will come down. and depends on the patient to patient. This patient, it is only when you come for the 30th day, his insulin level is 2.13 only. It's very low normal actually. And his blood sugar was 94 and HbA1c is 6.5, from 8.8 to 6.5. That is the result. So every parameters, and he was on so many medications, and by the 15th day itself, he came down his medications to reduced only the actually, yeah, we stopped they reduced the tapering of this statin and the cardiac medicine slowly, because he has so many medicines, and he was having immediate attack. No, by the 30th day, he is taking only this blood thinners and this Elaxiban twice a day, and ecosprin once a day, and Pantop, that is to this anti-acidity agent, that is to prevent gastric problem because of this blood thinners. So all the other medicines he was able to come out, and his blood parameters were come down. Only the HbA1c came down by the 90th day. His HbA1c is 5.3. Understand that it is without medicines, and also when you are coming on the 30th day itself without medicine, his BP is 100 by 60 without any antihypertensive agents. And by the first month itself, it is the medicine is over. Actually, he has come for the 1 year visit also. This 1 year review. When he came also, his HbA1c is 5.6. Without medicine, no medicine, his HbA1c is 5.6. And his almost, he had other problems also, that those problems also was got solved. And that is the result actually. That is actually, if you have, yeah, and for me, if the real treatment is if you are able to come out of the medication. If you put the stent, also you have to take this medicine and this person, because this person, this patient, he had to undergo that emergency stenting was needed. That is a must, because it is a massive attack and immediate, whatever is possible. If the clot said that also there is now facilities available to suck out the clots. If it is a clotting mechanism failure, it can be removed from those things is essential for this person. And also there are medication for to lysing the clots also. So such medicine definitely is needed. It is all life-saving. But the final thing is the lifestyle correction, and he was able to come out of all the medicine. And the second, by stenting also. Actually, he was visiting the cardiologist, and he was asked for the second stent, but because he's corrected with the blood pressure, sugar, and everything, he said he will be waiting and seeing. And after 3 months, actually, we did we will repeat cardiology assessment with echocardiogram and CMG and all. His cardiac function and even the muscle wall improvement was very much. So physically, he was very tired, and he was after coming out of the medication, was feeling energetic, and he started going for work and doing fine. And now after 1 year also, he's doing fine.
Actually, when we talk about lifestyle correction and all that, basically what we understand is most people, at least most patients, feel that it is a slow process. It will take a long time and all that. Generally, the feeling is that the reasons or the cause of this disease has developed over many years. So to remove the cause, if possible, or reverse the disease, it should take that many years. But from your what we hear, it is like one first day, then 7th day, then 15th day, then these tests are showing at each of these days that much of change. Uh, how does this particular situation affect the patients? What do they feel when this change is so fast?
Most of the patient, especially the cardiac patients, when they come the next visit itself, they will be very comfortable, and they say, feel a lot of difference, doctor, and feel much energetic. That is not only this patient, almost all the patients, especially youngsters, they feel much relieved after the timing. They are tied with so many medicines that their functions, cardiac function actually is blocking. Heart and blood vessel function is all in a mess with all these medicines actually. Which medicine actually, many of these medicines really, the medical field also, the researchers also don't know how all these medicines are acting on different part of our body. So when you're taking a medicine, it's not going to the heart alone, it is going all to the cells in the body. So this patient here also, how this fast result in this clinically supported lifestyle correction, how it is happening, that also the patient also should understand. Here again comes the immune system. So we should understand the immune system working, how it is, and the replacement of, actually the repair of the body is happening because the immune system is replacing our cells. Every second there is multiple millions of cells are replaced with the new cells. When you give enough nutrition and enough exercise to make this nutrition reach all the cells in our body, the immune system will replace all the damaged cells. In the heart patients, which part of the body is maximum affected? The blood vessels, the endothelium, the lining of the blood vessels. So what is the turnover time of this blood vessel and these cells? That is important. Actually, this lining cells, the turnover time is very less within almost all the cells, lining cells of our different organs, including blood vessels and also the respiratory tract, gastrointestinal tract, and all is very fast. It is, many of them is 4 to 6 days or 7 days or 5 to 10 days, and it is all depend on the all organs actually. The cardiac muscle, it may take you 1.5 years to 3 years for the muscle replacement, new cells to grow. But the lining, the blood vessel is very fast. Even the immune system, the most active, we all know that white blood cells. White blood cells, the turnover time is too fast. It is only 3 to 7 days. But the hemoglobin, that's red blood cells, that is where we are looking into the HbA1c. HbA1c correction, it will take almost 3 to 4 months, because the turnover time of this RBCs is 4 months, so 90 days to 4 months. But in youngsters, if you give correct nutrition and all, it will start very fast. That is why this person is HbA1c 8.5 to within a week it came down to I think 5. HbA1c came down from 8.8 to very fast, I think 7 point something. So that is because that much blood vessel, the damaged RBCs is replaced. So the repair mechanism is also directly depends on the turnover time of the cells. The different cells have a different turnover. The lining of the blood vessels and the blood WBCs itself is very fast. That is why the result also. So that is very, I don't think any other medication, only thing painkillers can give instant result. No other medication can give this fast result.
Actually, it is very difficult for normal people to understand the pace of this correcting lifestyle and its impact on heart health. Many patients, when they hear that their heart has a problem and some procedure is to be done and all that, generally they have a feeling of fear because surgery and all that. Generally, there is a feeling of fear. So, in your experience, when such patients uh, have this problem of facing a surgery and all that, what is it that actually they can possibly do to avoid a surgery if possible? And what is the preparations that they should do to understand the better solution?
See, for my patients, those who are coming to me, is basically hearing this videos. If a heart patient coming, there is watching my videos, and they may be looking for in the net. They will be looking what is the solution. So they may luckily they will come to across with the videos, and only those who are able to get some understanding, and they will watch more videos. And also there are clinic case studies also, that is like this sort of patients case study, what happened to each person, and they go through that, and they think that it is true, because in the net we cannot take it is very difficult to the understand which is correcting and which is cheating and truth, and it is very difficult to understand the truth and untruth nowadays distinguish. So they had to make a study, and if they believe, they come and they start treatment. And the major blocking factors, actually sometimes the parents want to they are understood, but the children are not do the homework. They have to do some homework, at least to do 2 or 3 hours of watching the video is needed to understand this. because it is not the conventional treatment methodology at all. The treatment methodology, everyone, if a bypass, if not doing the bypass, it is end of the life. That sort of belief is there. So they had to understand what is bypass, and so but with the people now, everyone is intelligent, and even you can see the bypass surgeries are there in the net itself. You can watch it, and what is the complexity and the side effect, everything you can get from the even the ChatGPT or the AI. There are different type of AIs are available. Even in the Google search, there is there. They'll give you almost all the side effects and all. But it will be very difficult for you to get about the result of this treatment methodology, which is it is not in the main field. But if you check with the CSLD, CCAP, or Dr. Jolie Thomson Life Care Center approach, you can get a lot of information, and you can look into the website also. So you can go, the patient who is looking for a solution, or those who want to come avoid bypass surgery or avoid angiography or stent, or even though you had all this, and even you want to come out of the medications, not only for the heart medication, diabetes, hypertension, and everything, you look into the website and see more videos, and find if you are feeling convincing, and if you are confident about your own immune system and your ability to correct your lifestyle, you can definitely, if it is if your organ is not too damaged, definitely you can get the result.
What about the patient example that you can take who has the fear of surgery?
There are some patients who are coming not because of much of understanding. They are not looked into the video and find out what is the reason. And in the website and all, only those who can deep understanding only will be able to find out. But one patient I can tell you, this is a lady who was just purely because of the fear she came to me. She's a 55-year-old lady, and 155 centimeter height, and weight is 57 kg. And she's diabetic and hypertensive for the last 20 years, and she's not with much of overweight or anything. And because of a sudden chest pain, she was taken to a hospital. And when they looked into, she had this ECG changes, ST segment elevation was there, and she was advised for an angiogram. And primary angiogram and angioplasty they are planning. But she was very worried about this thing, and she doesn't want to undergo that. Just like the same patient, actually, he had a massive attack. She also had a massive attack, but she was very frightened for going for the surgery. And her troponin level was 7,783 when we are. So it's very high troponin level. That means it is she has undergone a massive attack, and she had pain, abdominal pain. But initially, when she was coming to me, she was not knowing that this troponin level, which is the result was, I got it only next day. Then she came actually in the end of the OP time. Actually, my regular OP time is only afternoon, 12 o'clock. They come from the little far off place in the North Kerala. And one of her relative had treatment here, and he was able to avoid the bypass surgery. That is why they know about me, and they came to me. So because at that stage, that day I was not able to start the treatment, but because of her pain, and he was not, they took their own, they got on their own, they get discharged from the hospital ICU actually, and their own risk. So I had given her the pain relief and this sublingual tablets. Basic, that is the preliminary, that is basic thing I had given in the for time pain relief and all. I asked them if they had any problem, they had to go to the hospital, but she was not willing for going to the hospital. Anyway, complete trust and take this medications, and especially sorbitrate and some pain relief medicines and anti-acidity medicine, because she's having chest pain and abdominal pain. So I had given the medicines, and they went home. And if she's getting relief, she can come in the morning. That was that. And when the result come, this troponin was very high. It is clearly a massive attack, and the SpO2 was high, and the blood sugar was 309. And HSCRP, CRP, and only HSCRP cardiac mark is too high, 269. You usually see it to 5 or 6 or 7 and all. And ESR is high, so it's a very high inflammatory stage, her condition. Anyway, we started because she's symptomatically free by the next day, because of this preliminary emergency care itself, she was settled. So next day when we formally started, and the 8th day, her troponin level came down to 175, 1075. And in the 15th day, her troponin was 158, and by 30th day, troponin was normal, 10.9. So by 1 month, this cardiac that troponin level doesn't mean that the heart is completely cured, because the heart muscle repair, it will take time, because we are giving the optimal nutrition actually. So even this correcting the immune system, the omega-3 and omega-6 balance, we are trying to correct it to 1:1. So ideally, it should be less than 1:4. We are correcting the optimal level 1:1. That is why this fast result. And her HbA1c also came down from 9 to 8 by the 30th day. And by the 90th day, her HbA1c was 6.1. That all without, she was on other medication for the diabetes and all, without any medicine. This her blood parameters corrected. Her HbA1c came down to 6.1. Blood sugar was corrected in the first day itself. Within 24 hours, blood sugar was corrected. And HSCRP, actually HSCRP came down from 269 to 8th day, 33.2. And by 30th day, it has came down to normal, 0.4. So we are actually in this clinically supported lifestyle correction. Where we are treating is the immune system itself. The providing the optimal nutrition for the immune system and optimal exercise for the around 50 trillion cells in the body is there. And we are trying to optimize the stimulation of all these cells. That is called, that's why it's called cell activation protocol. CAP protocol and CAP diet, we are following this. And the result is so fast. And many the patients and the doctors will not be able to believe it. Only you have to experience it and try to understand the reason why this result is. Because this is the need of the day. Because we are not in a lifestyle diseases are increasing. Heart attack and sudden death is increasing. And even though we put the stent or the bypass or all the medications you are taking, your attack is attack and the untimely death is becoming more and more common. So we should understand, we have to go to the root cause. And our real doctor or the real healer is the immune system. They correct the immune system. It's an inflammatory disease, and our inflammation is there. Correct the inflammation. There are so many markers for the inflammatory markers, ESR, HSCRP. This patient's ESR also was very high, and that also came down. ESR, HSCRP, CRP, all these parameters also came down, and the patient is okay. After 1 year also, she had a 1 year follow-up also. She is maintaining her blood sugar also without any medication.
Actually, when it comes to diabetic patients, because most of these heart patients have diabetes and or BP and all that associated with it. When it comes to diabetic patients, it seems that this bypass is usually more often performed. But at the same time, we understand that the diabetes as such continues with the patient. Even after the bypass and everything is done, diabetes is there with the patient. So the patient is again getting ready for another event. So what is it that diabetes patients should particularly know? Can you give with an example, this serious diabetic patients? Because always what is happening is diabetes goes on, then one event comes, like a heart attack or a complication of diabetes. Then only everyone gets going. Then the centers of excellence will treat the event, and then everyone is waiting for the next event. So, what is it that patients like that? Can you give with an example?
Yes, that is the current scenario. The hospitals are for treating the events actually. So attack, hospital can. But preventing the attack is the patient's responsibility. So the doctors will not give much of they'll say that take the advice of the dietitian, go to the gym or do the activities, walking, swimming. So many advices that it has to be implemented by the patient. And with all these medications on eating a handful of medicine 3 times a day, and they will not be able to do it successfully. That is the problem actually now is happening. So that lacunae, I am actually with so much of effort, develop this protocol itself to cover fill that lacunae of how to correct the lifestyle in a systematic way. And it can be achieved within 3 months actually. Initial treatment protocol is 3 months, and then we taper off the support. And by the 6 months, the patient make the patient to manage themselves without medicine. This patient also having a high insulin level, 28, not like I had seen up to 250 and 300 insulin level, but she had only 28. Maximum level generally taking is only 25. And her insulin level also came down. And then usually I prefer to the patients to keep the insulin level around 4 or 5. And sometimes it is seen that it is only 2 or 3 with a normal blood sugar. That's only that much. If the insulin resistant, if your hormone system and everything is functioning normally, insulin level will be around 5 only. So, but many of the insulin resistance is there, and we had to correct that. And you had to fundamentally, you had to go into the details of the patient, and it is very easy. If the patient understands, and if you get a correct doctor to guide you in the lifestyle correction, then it is within 24 hours, blood sugar can be controlled. That is my experience, usually. Only if it's some patients, the craving can be there. In such, there is also we have mechanisms to deal with the craving also. I don't have the time to explain it here, but there are other videos about this whole Caesar recap program itself and how it is, and all is described in different videos. And those who are interested, especially the cardiac heart patients, diabetic patients definitely going for attacks will be very common in them because the blood vessels are getting damaged. So find some time to go into the details and understand the mechanism of this clinically supported lifestyle correction. And many, if you are not in a cardiac, in the emergency situation and all, those in a mild medication and all, you will be with the seeing the videos itself. Give you ideas, and I had many patients come and tell me that they are able to, just watching the video itself, they are able to come out of the medication also. But that is possible if you are not enter into the complication. But if you are a heart patient and taking so many medication, it will not be wise to go alone without guidance. Always take guidance and do it. I'll give an example of a patient who was already a diabetic patient for the last 35 years. He's a male, 65 years and 165 centimeter height and 76 kg overweight also he's. And he's diabetic for the last 35 years, hypertension 20 years, heart patient for the 18 years, and then BPH also, prostatic hyperplasia also is there. And he has undergone CABG, that is coronary artery bypass surgery, 2006. And again, angiogram and angioplasty in 2011 and 2020. He came to me in 2023, and that is after a failed stenting. That he had calcified plaques, and they tried this retractor sort of this breaking the plaque and putting that stent, and it was ended with a problem, and he was not able to do the stenting, and he was in the ICU for almost 2 weeks. And then after discharge, he came and he had a severe angina. Even the resting not much problem. He was finding it difficult to taking bath and doing his own activities. So it is very difficult condition. And his next option is only, he cannot undergo any of the procedures. And his next option is only heart transplantation, but it's not that easy procedure. So this patient also, he was able to come out of his discomforts and come out of so many medicines, diabetes, insulin injection, and everything was there. And his discomfort also is reduced. Actually, by the 30th day, he was, we asked the patients to, every visit, they will give a progress assessment chart also. There is a system to write it also. In the 90th day, he's saying that there is a just slight discomfort, dyspneic, he's become dyspneic when he's walking fast. So before that, he's not able to take a bath itself. And by the 90th day, he was able to come out of all the medicines. And because he has not put a stent, so he has come out of all the medications because the stenting was failed. So he has come out of all the medicines within a month itself, and his exercise tolerance has increased. But he had this blocks, CAMT was also showing problem. So he needs more time. It's to come out of all the plaques and all, it will take more time. So the patient has to follow the directions and this protocol. For they did not usually we give active active support for the first 90 days, and then gradually making the patient independent. And by the 60th day, only once in a year, after 3 months also, usually we follow it up on the 270 day, and then yearly. And if the patient is more of, depends on the patient also, every 6 months or 3 months, 1 year follow up. And that is the pattern we are following.
Actually, when it comes to patients, heart patients, generally we see that the blocks are not only in the heart vessels, but the blocks are there in other organs also, like the kidney or even in the other blood vessels of the leg and arms or wherever. So, what is it that actually patients can learn from any example where the treatment was not only for the heart but for the other blocks also along with it, because generally when we see treatments like bypass or angiogram and stenting and all that, it is for the heart usually, and when it is done for the heart, it is basically focused on the heart only. So how is it that lifestyle correction can treat it on the whole body's level?
We are always thinking about the heart. Prime importance will be given to heart. So heart, if you should understand that if you have the blocks in the heart blood vessel, there are other part of the blood vessel organs, other part of the body, other organs, kidney, liver, legs, etc. Also, or the brain itself, right? The very gentle or very fragile blood vessels, they all will be affected. So if you have a heart attack, or the possibility is there, or you had a heart attack, you are prone for a stroke also. Everyone should remember that. And also your kidney may be failing. So we'll wait, usually wait till the end. You should look for a GFR. If the GFR is coming below 90, you should take care of that also. And most of the patients will be having fatty liver, but generally the patients will ignore that. And even the doctor, because there's no treatment. For the kidney failure, there's no treatment. Only at the end stage, you can do the dialysis or the transplant. Or the liver also, there is no treatment. Fatty liver, cirrhosis, fibrosis, no treatment. So modern medicine is helpless in that. But you are not helpless. You can correct it. With the lifestyle correction, you can reverse the fatty liver. And many of the culprit for the fatty liver also is high insulin. I'll give an example of a patient who is suffering from peripheral artery disease along with the heart disease. And this is a 72-year-old man. He was actually he's a US citizen actually. He's Malayali. He's a Keralite, settled in Indian, settled in US for the last more than 40 years. And his height is 158 centimeters and weight is 68 kg. And he's suffering from diabetes for the last 35 years, dyslipidemia 5 years, hypertension 10 years. And he was undergone a bypass surgery in 1 year back, in 2024 actually. He came to me in 2025, this year only. And he was, his problem is, actually he wanted to try this clinically supported lifestyle correction before his heart surgery, that is bypass surgery. But his children are doctors, and all are in the family also. So many doctors and medical professions are there, and they didn't allow him to try this. And after the bypass surgery, also he's not able to walk even small distance, and his leg is his foot is getting darkened, and he's worried that he need a amputation or anything because he's diabetic also. So that in the US they are said that you can put a stent in the leg vessel also. Leg vessel, that is the only thing they can offer. But even the small, the foot blood vessels, that is very small blood vessels, there you cannot put a stent in the foot and all. Only the major blood vessel of the major blood vessel of the leg you can put. But even if you put the stent, the distal part of the artery also, because diabetic patients, small arteries also will be affected. So no use of putting the stent and even damage, because in the possibility of clot formation of the stent and blocking the major blood vessel itself is a great threat. So they finally came down to Kerala, and they started treatment. The beauty of this thing for the peripheral artery disease, you can to see the do the Doppler study and see the opening of the blood vessel itself. Initially, many of the blood vessels, that's we can see how much blood flow is there and all. And within 2 months itself, many of his blood vessels have started opening. If the leg blood vessel is getting opened, definitely the heart blood vessels also can get opened. Only thing, the problem is the coronary artery. We cannot put the stent on that, and because the rib cage is there, thick chest wall is there, we cannot directly do the Doppler study there. But in the other, that is why in the clinically supported lifestyle for correction for the heart patients, we do routinely CIMT, that is carotid artery intima media thickness. That is the as a measuring the fat deposits inside the major blood vessels which is supplying the brain. And if they have any leg problem, peripheral artery disease is there suspecting, we do the Doppler study of the artery for the leg. And we can see these blood vessels are getting opened. And especially the food blood vessels and all, the dorsalis pedis and all, it's all medical terms of the name of the artery and all. It's all getting opened actually. And we can see, and also this patient result, the patient is able to walk. That is the most important for the patient. Patient will not be, but now not in the medical, the blood reports or the Doppler study is important, comes only if they get a relief. And when we do this test also, it is getting opened, it is much relief for the patient. It is they are getting symptomatic relief, and it is evident in the report also.
When patients who have undergone bypass surgery or stenting, their most important criteria condition that they would like to know is what happens to their medications. That is, in case you are treating them under this life care correction program, what happens, because they will be under the belief that they have to take medications usually lifelong, and that is what is generally the concept.
See, basically, those who are interested in this clinically supported lifestyle correction, or anyone who's having a heart patient should be interested in that. Then only you can come out of this. So in this, you can, if you are not put a stent in the last 12 months, you can, most of these cardiac associated medications like diabetes, hypertension, and these things, you can come out within a month itself. But if you have put the stent within this 1 year, that blood thinners, you have to continue. That is a must. Otherwise, that is to protect you from the side effect of the stent. Otherwise, you can come out of the medication within a month itself. And basically, the takeaway from this, my suggestion to the patients who are had a angioplasty, bypass surgery, or having advised and not done, or whatever they have undergone also, if you are willing to correct your lifestyle, you can come out of the medication within a month itself. And only variation, this exception is you have to test it. So you should be willing for that. You can feel it. No one can. Most of the patient is telling me that, doctor, I never thought this much relief and this is possible. But many are because it is against the current norm. There is no treatment like that. I don't think in any part of the world such a treatment is such a clarity and with evidence-based medication, evidence-based service for this lifestyle diseases like this is provided. Because I know I get different parts of the world, the European countries and the African countries and Australia, New Zealand, and everywhere, US, every part of the world, I get patients, and it's mainly these Indians itself are coming to for this treatment here. And I see there is nowhere else in the world this sort of a protocol or treatment schedule is there. If anyone, this patient also, they came down to here, and because they are a native of here and they are already retired, they stayed here for the 3 months. And by the 3 months, everything is all the medicines. He's also came out of medication within the first month itself, and cleared his problems and gone back. Only thing they are worried that what in American citizens, they are always worried that, doctor, what will I do? They have their insurance. Then people will look for whether I'm taking the medication regularly. Why should I take all that medicine? That if the person who is not having diabetes or hypertension, they cannot take such medicine. It will be harming them. So they are usually what they do is they tell the doctors they are taking the medicine, but the doctors are checking the blood and blood parameters. It is checked. It is everything is normal. So it is very difficult. The patient find it difficult to tell the truth to their physicians, especially here. It is not in India. It is not a big problem because they don't need much of the other care also. But in Western countries, it is the insurance point of view. They have to take all these medicines, and otherwise it's a problem. They will not get the insurance coverage and all things. Such problems are there, but the thing is, you can get out of your problems if you are willing, and if you are not too late.
The simple thing is that lifestyle diseases actually no medication can cure a lifestyle disease. The only cure comes from how you manage your lifestyle. The rest is all temporary corrections which give you time, but the time is really meant for you to decide on how you will correct your lifestyle to prevent a recurrence of the event. Thank you. The informed patient is key to treatment success.